of WHO, he mentioned about the agreement between India and the WHO to establish global WHO collaborating center for center for the traditional medicine in India, and this is the biggest development, I believe. And this development is basically to implement the WHO strategy 2014-2023 and the different aspects of it, and to support all the traditional systems of medicine in the world. So it is not only for the India, it is to help all the traditional systems of medicine in the world. And this is the biggest development, and we are thankful for uh, the trust that the WHO has shown on the Ministry of Ayush and the Government of India. So we are thankful for that. At the same time, the Prime Minister, he also gave some very good directions. He mentioned about the not only the genomics, but he mentioned about starting new branches like Ayurphysics and Ayurchemistry, because there is a lot of things which actually we can have this integration. So the overall thrust of the speech was on integration of the traditional medicine with the basic sciences, the integration in the public health, the integration in the education. So this was the basic thrust of his speech. And then he also mentioned about the starting interdisciplinary doctoral and postdoctoral programs. So this was the overall theme of his speech, and he gave many new directions. And I believe that in coming days, there will be a lot of change probably in India as well as in the world pertaining to the traditional medicine and its integration in different aspects of life, whether it is the promotion of health, whether it is the well-being, whether it is pertaining to the treatment of diseases, and so on. Mr. Pathak, probably because he is in Jaipur, and there were two programs which were happening simultaneously. One program was the dedication of the Institute of Teaching and Research at Jamnagar as the Institute of National Importance. So this was one program at Jamnagar, Gujarat. The secretary is there physically, and Mr. Pathak, he's there at Jaipur because the National Institute of Ayurveda Jaipur. So today it has been elevated to be deemed to be university under the de novo category. So this is the development, and that's why Mr. Pathak is there. Maybe we can wait for a maybe minute or two if everybody agrees, but if he who is able to join. Otherwise, we can, after a minute or so, according to my time, it is nearly 12 o'clock, 12 noon. It is too late in USA. I know it is the midnight, but still I'm thankful that you have sacrificed your sleep for today for the Ayurveda day, and you are still there. But we will try to free you as early as possible.
Ross looking fit.
Not really.
Yeah, because
It's light. It's only 1:30 a.m.
Okay, that is your normal activity.
He is very hardworking and full of dedication.
He is.
Seems easy.
Yeah.
He makes.
So I think when he comes, we will accommodate him in between the schedule, and without waiting much, we can go ahead. So to just give an outline, not only to the speakers and panelists, but to all those who have joined this webinar through the web platform as well as through the social media, because we have given the wide publicity. Hello. भेज दिया था सर। Yes, Mr. Pathak, he is trying to join and he is not actually able to join. So maybe within a minute he will join. He is trying to join. So in the meantime, I will give you the brief introduction about this webinar, that why this webinar is there. As you know, this COVID pandemic is affecting the whole nation, and not only the nation but the entire world. And there is no any proven medicine, so all the countries across the globe, so they are struggling. And during this pandemic, the Ministry of Ayush, we focused on improving the immunity to protect the community from COVID. And for that, we intensely used Ayurvedic interventions. And these are in the two forms. One is the preventive aspect, and the another is the treatment part. And this aspect, what we actually adopted, so that gave significant benefit to the people. In the coming research presentations, everybody will come to know that how the various researches they were conducted by the ministry and what are the outcomes. So in that we have the public health research also, we have the clinical research also, we also have the hospital management, at the same time the prophylactic studies, and further going to the molecular understanding and the genomics understanding of these various studies. So the ministry not only has given the thrust on providing the health services through Ayurveda in the COVID, but at the same time to undertake the research to prove the scientific validity of the various interventions and generate the evidence. So this is the theme, and during this endeavor, we have collaborated with the domestic partners as well as the international partners. And today's webinar is really intercontinental in true sense, because we have speakers from across the continents. We have the speakers from Australia, we have speakers from Africa, we have speakers from Asia, we have speakers from South America as well as from the North America. So all the continents, they are there, and that's why the today's webinar is really an intercontinental seminar. And in this seminar, all the researchers they will present their views, their work, at the same time whatever the outcomes are there, and the future thought, the future direction. So to begin with, we will have this presentation, and followed by there will be a panel discussion. And in the panel discussion, we have the panelists from the different part of the countries, and these panelists, they represent the industry sector, that is the manufacturers, the academia, the practitioners, as well as the researchers. So the experts from all the fields, they are there in the panel also. So this is the overall ambit of the today's webinar, and this webinar of 2.5 hours or 3 hours. So this will give us the overall understanding of the various initiatives from the scientific perspective. Suniti, whether Mr. Pathak has been able to join? Dr. Suniti, whether Mr. Pathak has been able to join?
Sir, I just spoke to him. He is joining. उनको link अभी भेजा है हमने. He is joining. Trying
Okay,
like
okay,
कुछ connectivity की problem है. Sir आ गए. Sir
okay.
join कर लिया. He is joined. Sir.
In the meantime, I would also like to mention you that in these last 6 months, the ministry has launched 82 research projects at 112 locations, and the research span activities from the molecular, cellular, the genomics, clinical, as well as the public health research. So this is vast research activities that we have undertaken. So, as soon as Mr. Pathak joins, we will start the program, and we will have a photo session in the beginning of the program itself, because some of the speakers as well as the panelists, they might not be available at the end of this program. So we will have the photo session in the beginning itself. And after that, we will start with this webinar. My humble request to all the speakers to keep their mic on mute mode. At the same time, their video, it should be on, so that we can have the photograph. And this a particular webinar, we have also informed to all the Indian missions, the Indian embassies, and the Indian high commissions across the world. We have given the wide publicity, and we believe that many international participants, they will be there. Those who are watching this webinar, either through the internet platform or through the social media. At the same time, we have also communicated about this webinar to all the academia, that is the Ayurveda colleges, as well as the research institutes, the practitioners, the various associations, the industry chambers. So we have given wide publicity to this. I believe that this has reached not less than 5 million delegates in India itself. And within short time, we will come to know that how many participants they have actually logged on. So I welcome Mr. Pathak. He is able to join. I welcome you, Mr. Pathak. So we will, so I had just given the background of the program as well as the inaugural program, and we utilize this time. We know that you were busy in Jaipur. At the same time, you also had some technical problem in joining. But now, since Mr. Pathak is there, I welcome you, Mr. Pathak. Mr. Pathak is the additional secretary and very senior administrator in the Ministry of Ayush. He has extensive experience of working in different diverse fields like the internal security, Ayush, the forest, the information and broadcasting. So these are diverse portfolio. I welcome you, Mr. Pathak, for this webinar, and I request you to address the participants as well as the those who have logged on regarding the various initiatives that the ministry has taken. Mr. Pathak, please.
Thank you, Dr. Nesri. First of all, I extend a warm congratulations to all the participants on the occasion of 5th Ayurveda Day. At the outset, on behalf of Ministry of Ayush, I extend a warm welcome to experts and participants from all over the world at the international webinar on Ayurveda on COVID-19 pandemic on the occasion of 5th Ayurveda Day celebration. As you are all aware, a short while ago, Honorable Prime Minister dedicated to the nation two institutes. One is Institute of Training and Research in Ayurveda in Jamnagar, and second, deemed to be university status to National Institute of Ayurveda, Jaipur, to the nation. On this occasion, DG Director General WHO also made an important announcement that Global Center of Traditional Medicine will be established in India under the supervision of WHO, and WHO will be providing all support for carrying out research and development activity in the field of traditional medicine to this center. So it is a matter of great satisfaction and pride for India that WHO is setting up its Global Center of Traditional Medicine in India. I extend my sincere appreciation for the support and interest for participating in this event. This platform will provide an opportunity to bring academicians, researchers, scientists, practitioners, and other stakeholders of Ayurveda from across the globe on a single platform to share their experience on the research on COVID-19 pandemic. As you are all aware, COVID-19 pandemic has presented an unprecedented challenge to entire medical fraternity and global healthcare infrastructure. It has been witnessed that Ayurveda has significantly contributed in maintaining the good health status of the people in India during this pandemic. The classical Ayurveda text mentions about epidemic management and defines immunity as the ability to prevent and arrest the progression of disease. The Ayurveda pays larger emphasis on building strength of mind and body to cope with various stressors, including infection. Various clinical studies have evidenced a vital role of Ayurveda in mitigation and management of COVID-19. Through a graded, preemptive and proactive approach, Government of India has been taking several steps along with the states, union territories for prevention, containment and management of COVID-19. Ministry of Ayush has taken many initiatives for the prevention of disease by enhancing immunity and to develop safe and effective medicines and intervention for COVID-19 through Ayurveda. An advisory has been issued about self-care guidelines and preventive health measures for boosting immunity. The advisory of Ayush was translated in 9 foreign languages and was disseminated across the world. It is observed that globally there is a phenomenal growth in the export of Ayurvedic medicines for strengthening immunity during the current pandemic. Honorable Prime Minister of India, in his address to the nation regarding combating COVID-19, has mentioned 7 steps, among which one step is to follow the guidelines issued by Ministry of Ayush for improving immunity. Larger number of scientific studies and clinical trials on Ayurveda are being conducted since the past 7 months, in which most of the studies are at near completion. The trends indicate that Ayurveda and traditional system of medicine has become very effective in containment, and management of COVID-19. And it helps prevention of infection, and where the infection takes place, it helps deterioration to the severe level. A mobile application is Ayush Sanjeevani has been launched for undertaking a population study on the effect of Ayush advisory and the Ayush formulation in promoting health of people through digital platform. About 1.2% of Indian population they participated in this study, which is nearly about 1.5 crores, and it was found that 85.1% the person who participated in these studies, they supported, they claimed that they have used the traditional system of medicine, including Ayurveda, Unani, Siddha, and other traditional system of medicine. Based on the evidence of clinical efficacy of Ayurvedic herb Tinospora, Cardifolia, or Guduchi, and Ayurvedic formulation Chyanpras, these two Ayurvedic products have been integrated in the National Clinical Management Protocol for COVID-19 of Government of India. At global level, Ministry of Ayush has collaborated with academic partners across the continents, including the countries like USA, UK, Brazil, Germany, Argentina, South Africa, and Ghana. It is my pleasure to inform that a joint research proposal on COVID-19 through Ayurveda has been submitted by the Ministry of Ayush with Brazil and South Africa under BRICS STI framework program. We are looking forward for the positive outcome in this regard. At the end, I once again extend warm welcome to all the participants and hope for the fruitful deliberation during the webinar. The event will also explore innovations that best adapt to our practices and improve access to health in a changing world. Thank you and wish you a successful deliberation in the coming webinar. You are not audible. Dr. Nesri is not audible.
Sorry. Thank you, Patak sir, for your address. Honorable Minister for Ayush, Mr. Sripad Naik, he has arrived, and I welcome you, sir, on behalf of the Ministry of Ayush, at the same time on the behalf of all the participants. Sir, for your information, all the participants, they are from the across globe. They are from different continents, right from Australia up to USA and the South America. We will like to have a group photograph on the web itself before actually we proceed. So all those who are there on the screen, please log on and switch on your camera so that everybody can have your photograph.
She's also joining. And अरे जल्दी कर यहाँ बोले
नाम नहीं आया. So thank you. In the inaugural program, as I briefed just before, the Honorable Minister, he welcomed the Prime Minister and he addressed the nation as well as all the stakeholders about the various initiatives that the ministry has taken about the COVID and the COVID pandemic. At the same time, he also wished everybody about the Ayurveda Day and the Dhanvantari Day, because all of you know that the Dhanvantari Day is the Ayurveda Day. Before I proceed further, I would like to request once again to Honorable Minister to say a few words, maybe for 1 or 2 minutes, for all the participants, those who are there in this webinar, as well as those who are logged on from the different part of the country and the world.
Good noon to everybody. I'm very much proud to join you after completing our main program. And that program, Honorable Prime Minister was there in that program, and you have blessed all of us. Today, our National Institute of Ayurveda from Jaipur, government has given that institute a Institute of National Important deemed university, and Gujarat, Jamnagar, our university, has given a status of Institute of National Importance. Friends, today is the Dhanvantri Day. We are celebrating it as a Ayurveda Day today. And I am very much delighted that a big video conference on Ayush and regarding the COVID that we are going to discuss and submit our putting before our thought before all of us. Ayush Mantralaya, Ayush Ministry is working tirelessly last 6 years, and you have seen that this COVID pandemic 7 months was passed, and all of our officers, our doctors from every Indian system of medicine's faculty have done their job very nicely, and because of that, because of your help and your tireless working, we can control the COVID-19 here. I think this is the right time to take our Ayurveda and traditional medicine forward, and with your help, with your blessing, we will definitely, not in India, but we can take our Ayurveda and other system of medicine to the world also. Many foreign countries, I think you have been knowing that around about 15 other countries have signed MOU with us. We have given around about 14 chairs to the foreign universities, and by this way, we are going step by step ahead. Also, we have started around about 34 information center in 30 countries also. With the effort of our officers, we have done what we can do for the Ayush and our Indian system of medicine. I think with your support, we will continue to give the helps, and we take our Ayush system of medicine to the world. With this world, I thanks all of you and use my greeting for Diwali and Dhanvantri Day. Thank you very much. Jai Hind.
Thank you very much, sir, for your blessings and your guidance. And under your guidance, in last 6 years, we have done significant progress. And this webinar is one of the initiative of that. So thank you very much. So when we talk about the COVID, it would be important to know the Ayurvedic approach, that how actually we know the COVID, how do we understand the COVID, and how do we design the treatment for the COVID, because COVID is a new disease. And when the new disease is there, everybody was struggling to understand the disease. But then in Ayurveda, there is a specific methodology which is described to define or to understand any disease, understand the pathogenesis, and then on the basis of how the treatment can be designed. So I would like to give an overall idea within 5 minutes about the conceptual understanding of the Ayurveda. Whether the slides are seen?
No,
Whether
sir.
everybody-
No, sir.
Not yet.
No, not visible.
Not visible.
Okay.
Dr. Nate, could we switch off the videos for clarity in transmission? Otherwise, it is breaking because we've all switched on the videos. So, could we go to the audio mode for ease of transmission, except for the speaker?
Is it visible now?
Yes, it is visible.
Yes, yes.
Now it is visible.
Yes, sir.
Thank you, sir. So this is the Ayurvedic approach toward the COVID-19. As we know that the COVID is an epidemic, and this epidemic is not new to Ayurveda, because in the ancient time also there used to be epidemics and the pandemics, and the word which was used for this epidemic was the Janapada Dhvos, in which Janapada is the large population or the community, and Dhvos is the destruction. So this Janapada Dhvos, it was mentioned in the ancient books. And then there are various reasons which are mentioned about the why the epidemics they could do come and how to avoid them. So all those descriptions, they are there in the Charak Samhita and Sushit Samhita and all the ancient texts. So in this, they are also called as Aupasargik or the Sankramak, that is, they are the infectious diseases and they are the communicable diseases, and the mode of communication, it may be because of the touch, it may be because of the contact, it may be because of the physical relations, it may be through the breath, or it may be because of sharing of the garments and the food and everything. So these are the various modes of the infection diseases which is mentioned. And as we know, this is applicable, especially the breathe, because the COVID, it spreads through the breath. So this is there. And in this, the main presenting feature for the COVID is the fever. And there is a classification for the various diseases which is mentioned in the Ayurvedic text, especially in the Charak Samhita, in which there are 30 chapters, and these 30 chapters, they are the classification of the diseases. So all various diseases with the dominant manifesting presentation of fever, so they are grouped under the category of Jwara. Jwara, they are the fever. And in that, they are there are different types, that is Vataja, Pittaja, Kaphaja, depending upon the dosha. Those who know a little bit about Ayurveda, they can understand that the entire Ayurveda philosophy, it is based on the three dosha, that is Vat, Pitta, and Kapha. And then there is a specific mechanism how to actually understand that. So I'm not going into details, but in this fever, on one hand, the agantuja, that is those who are not caused by the Vat, Pitta, Kapha, but then there is some external cause for that, whether it is infection, whether it is a trauma, whether it is something else. So that is there. And then there are the internal factors. But though it is there, whenever there is any infection, but that further actually should stimulate or the aggravate the dosha. So without the dosha, they are involved, there cannot be disease. So it is important to understand that what type of dosha is involved in the particular disease, and that is depending upon the which symptoms they are manifested. Now in this particular COVID, we see the typical conditions like the sore throat, fever, and a headache. At the same time, there are some other symptoms also. But when we go into the understanding of the Vata Kapha Jwara or the Vata Shleshma Jwara, the basics or the common symptoms, they are the sore throat, fever, cough, and headache. In the Vata Pitta Jwara, it is insomnia, it is anorexia, it is the high fever. So the intensity of fever is important. In Vata Kaphaja, it is moderate. In the Vata Pitta, it is a very high fever, but then the pattern is not very specific. And the Kapha Pittaja, it is also associated with the drowsiness, confusion. So the symptoms of the related to the central nervous system, so they are also there in the Kapha Pitta Jwara. And in the All India Institute of Ayurveda, various patients, when they were studied on the manifestation of the various symptoms, so 45% of the patient, they had the fever, almost 30% they had the headache, and 35 to 40% they had body ache, and 20% they had cough. So mainly it is the fever, cough, the headache, and the body ache, and that goes towards the Vata Kapha Jwara. So we diagnosed the COVID largely as the Vata Kapha Jwara, but that doesn't mean that the COVID is Vata Kapha Jwara itself, but there could be the presentations of the Pitta Kapha Jwara and the Vata Pitta Jwara as well. Because the temperature, it is the Madhya Vega, that is the moderate temperature. The onset is Yugapad, that is the simultaneous everywhere. The severe body ache. So all these symptoms, they are because of the Vata Kapha. and this actually helps in understanding the disease. So deciding the dose is important. And while going to the treatment, it is not very important that what kind of formulation actually we are using, but then it is very important to understand the dosha at the basic level. And at the same time, there are many other factors, that is the age, then what are the various symptoms, what are the clinical manifestations. So that is also very important. So the only particular formulation is not so important when we are talking about the treatment. So treatment is little different, and when we go for the research is a little different. So this differentiation we have to make, and that's why in Ayurveda it is mentioned that na yoga hi eva kevalam. So it is not only the yoga, the only formulation is not of greatest importance. And what other things that we have to keep in mind, it is the how the various factors they are affecting the body. Then what is the strength of the body, whether the fever is new, or what is the chronicity of the fever, and how the various causative factors they actually have led to the development of the pathogenesis. So that's why it is mentioned that yato yavanto gyanopaya. So we have to understand from the various aspects of the knowledge that how the disease has been developed, and then we can decide the treatment. And then there is also one question which was asked very frequently in India, that those who are COVID positive, but then those do not have any symptoms, so how do you treat them? And then there is clear-cut instructions in the ancient text that no anutpannasya vyadehe lakshanam bhavati. So unless and until the symptoms are presented, whether they are in a mild form or even the prodromal symptoms, so unless and until the symptoms are present, it is not considered as the disease. So simply having the lab report as positive doesn't mean that the person is going to have the COVID, because there were many surveys which were conducted, and they found that almost 30% of the population they had this lab test positive, but not everybody had COVID positive. So there could be the lab test, the infection could be there, but because of their immunity, they could fight with the disease and the symptoms were not developed. So this aspect that we have to keep in mind, and when we design the treatment, it should be having the different aspects, that is the it should be jvaran dosha kramapekshi, that is we should focus on the dosha of the fever, and that's why the drug what we select, it should have the action against the dosha. It should have action supportive to the dhatu, that is the tissues, because the tissues they get damaged. Then it should have the affinity to the specific organ. Say for example, when in COVID, if the cough is there, so the drug what we select should have the affinity to the lungs. It should go to the lungs, and we should act against the specific symptoms. So the symptom relieving activity should also be there, and whilst having all these properties, it should be well tolerant to the patient. So this is the basic guidelines while selecting the drug, and these are the various medicinal plants in which Guduchi is the most spoken, the Ashwagandha is most spoken, but at the same time, the Glycyrrhiza glabra or the sweet flag or the Yashtimadu and Swarshia chirata or chiraita is also very important medicinal plant, and they have been found useful in the clinical practice in Ayurveda. So this is the basic background, and with this background, now I would like to invite Professor Tanuja Nesri to give her presentation. Tanuja Nesri, she is the professor.
If you can stop present sharing.
Yes,
Stop
I'm
sharing.
trying. I'm trying. Yes. So now I would request Professor Tanuja Nesri to make a presentation. Tanuja Nesri, she is the director of All India Institute of Ayurveda, and she is the authority in Dravya Gun, that is the herbal pharmacology. At the same time, she has done extensive research on the Medya Rasayana, which is a special class of the psychotropic drugs which are mentioned in Ayurveda. and she is internationally acclaimed Ayurveda teacher and researcher and expert of Ayurveda. I request you, Madam Professor Tarujaneshri, for your presentation.
Thank you. Honorable Secretary, Additional Secretary Pathakji, Honorable Minister, Sripad Yashwanaikji, Professor Dr. Manoj Nesri, all the esteemed panelists, speaker, and distinguished audience. On behalf of All India Institute of Ayurveda, I take this opportunity to extend the greetings for Dhantrayodashi, Dhanvantari Divas, Ayurveda Day, and also we wish you healthy and happy days in this testing time.
Madam, your presentation is not
Yes, I'm trying to share the presentation. Just please give me a moment. Okay. Until the presentation is being loaded and being shared, I take this opportunity to inform the various initiatives what All India Institute of Ayurveda has taken during last 9 months. When the first advisory was notified by Ministry of Ayush as a self-care measure, and this ministry was the first ministry to notify the advisory and for the self-care when the entire world was under the lockdown and for the immune boosting measure. And we are the one, All India Institute of Ayurveda is the one. Yes, there is a no sharing option, please. Please make me the co-host. There is no sharing option, please. Dr. Nesri, can you please share it? Sharing option is not there.
Ma'am, sharing option is at the top left, third icon.
Top left, third icon. Yes.
Yes, ma'am. File edit share.
Yes.
Yes, ma'am.
Yes. Okay. Thank you. And All India Institute of Ayurveda has practically implemented the advisory. नहीं हो रहा है.
Nishan, can you please help?
Yes, ma'am. What needs to be done? Please tell me.
She is not able to actually upload her presentation.
It's okay. Sharing option is not there, but that does not stop me sharing. The presentation is only way to share the information and the initiatives. So what All India Institute did the first is we started practically implementing, and all of us, all our colleagues, 450, we started taking this advisory practically. We have taken the kashayas, kadha, and the chavanprash and sanchamani vati and anutel, and we had just
Let's go. Play from start.
and we did this on the research mode. And can you see this PowerPoint? Hello. Am I audible?
Oh, madam.
Can you, is it visible?
No, your presentation is not seen.
Okay. Okay, कोई बात नहीं. There is no.
Just a minute, ma'am. I'm just helping it out.
Yes.
I'm just getting it uploaded. No problem.
Yes. So we started using it, and the same was done with the research mode, and we did it as the research on the advisory, and we had tested all the immune markers of each and everyone who has taken the advisory. And fortunately, till now, all of us, majority of us are safe. That itself says that taking the holistic measure as a preventive, that really helps. And we
Yes,
are
now it
safe
is seen.
amidst this pandemic situation. And moving ahead, I will not take much time as but then,
Presentation is
as
visible now.
everyone knows, this about the Ayurveda is a science of healthy and happy life, but the prevention and promotion of the health is the strength of Ayurveda, and that's what till now we have started using all our measures, including diet, lifestyle changes, controlled celibacy, and the sleep, because 6 to 8 hours sleep is very important. So the advocacy on the preventive measures and the promotive measures of Ayurveda is the one which was needed to reach to the each and every citizen of India and across the globe. And that's what we did as an awareness about the Ayurveda in this testing time. And really, it has got a great potential. And when we say that the Ayurveda is not the science of the wellness. It brings from illness to wellness, but it also gives more happiness, and that's what we have observed in our COVID center. That all our effect measures have really helped all the patients to bring the spiritual wellness and mental wellness also. And it's the greatest monumental gift to the of Ayurveda from the India to the entire world. And as everyone knows that it is not only Jadi Buti wala science, folklore medicine, but it has got all 8 branches with very systematic approach of understanding cause, effect, and the holistic management with the biopurification, oral measure, medication, diet, lifestyle, and yoga. And that's what we did. As Dr. Manoj Nesri pointed out about the approach of understanding COVID and the holistic approach of management, we have designed a standard protocol according to Ayurvedic understanding. And if you appreciate that the Ayurveda has a tailor-made designer approach as a Vata, Pitta, and Kapha, and that also we have understood in designing the management protocol. And that's what is a practitioner's guideline which is uploaded by the ministry. And like Ayurveda is a deeply rooted in the indigenous system of India, in our community and public health. And there is a great potential to meet the health challenges and to bring the wellness. And that's what all the public health initiatives, what you have witnessed now are doing, and that is to the strength of 700,000 practitioners across India, and the many institutions and the robust infrastructure. Coming to All India Institute of Ayurveda, which is a tertiary care center, aims for Ayurveda, we can say, and it was dedicated to nation by our Honorable Prime Minister, and we have footfall of 2,000 patients visiting per day for our specialized holistic unit, and we are also serving to the nation in our public health initiative, and we are the Nobel Center for Ayushman Bharat. And what we are doing, all this research, public health activities, and academics, because of our very, very collaboration and the MOU partners, very, very premier collaborators within India and across India. We are really blessed and honored to have visited Prince Charles Foundation, the Honorable, none other than the Honorable His Excellency Principal Prince Charles, and our President of India having keen interest in the medicinal plants. And we also, another end, the administrative Vasna, we have the MOU with the IIT's technology and many premier institutions and across the globe. Like, I'm happy that Dr. Amit Bhargav has joined our MOU partner from the Spalding Rehab, Dr. Ross Zopante and Ariana, and many like from Austria, Ghosh, And so all our MOU partners, they are joined in the webinar, and we are really thankful and we are blessed to have this meaningful relationship, which is really helping us even in this COVID pandemic. We are on the verge of initiating MOUs and collaborative research project with these very highly accomplished partner. And very importantly, I would like to mention here that COVID pandemic, like this situation cannot be only treated by only physician. Ayurveda says that chikitsa chatushpad, that means it is a healthcare management system. We need to have good quality, safety and efficacy ensure medicine for the standardization, and we have pharmacopoeia, and we have All India Institute of Ayurveda. We have our teaching pharmacy, even though it is beginning we have started. But more important is nursing and paramedical staff. And here we are training, we have the training for our paramedical staff also. And across the globe, the more important, because the treatment management system is a more with the participation of the patient. When we say that my health is my responsibility, the patient's participation in terms of diet, lifestyle, and the celibacy, it's very, very important. And in COVID pandemic, we have realized that the one who had really shouldered the responsibility on themselves, they are safe. Not because since last 9 months there is no vaccine nor solution, but only it is the patient participation which is very important, and that's how we are doing the robust awareness program and patient education. And in this COVID pandemic, why we are successful? Because we have strengthened all our pillars in the healthcare management. And that's the key of the success. That's what we repeat. And it is that's why the various initiatives start from the academics, hospital services, public health, and research, because research is very important, and also media outreach services. And as since the panel and the audience is highly accomplished, but what we could do in this understanding COVID pathophysiology, where we have and when we see the number which is increasing across the globe, and also in India, again we are on the verge of second peak, but fortunately our mortality rate is comparatively very low, and good news is that the number of infected is less than number of recovered daily, and that is because of observing various public health initiatives through Ayurveda and the preventive measures. And what we can do, we understood the pathophysiology, novel coronavirus novelty, and then we really did the management at Ayush level and under the direction of Ayush at All India Institute, where it was preventive, it was management, curative, treatment. Yes, we can say with the confidence we could treat the patient, and also post-COVID management as a restorative and rejuvenating. And these are some of the do's and don'ts, many posters and the many awareness programs starting from the pediatric to the geriatric we uploaded, and that's how we could really create the awareness. And also the understanding the COVID, then we could do is preventing the virus entering into our cell. That was the first measure, with all physical measures like nasal administration, then also gargling and the nasal cooling by physiological mask as a oil really prevents entry of the virus and binding the virus to the living cell, and then stopping the replication in its when it gets inside the cell through the antiviral like turmeric and the spices like cinnamon, ginger, and many others. And more important, with our rejuvenating immunomodulatory herb as a reducing damage that occurs to our tissue. So at 3 levels, we could do all the measures with physical, general, and the specific measures as it is in the advisory. Even when the symptoms are there, till now, none of us has taken in nor antibiotic, nor any allergic, or nor any antiviral, but the simple Ayurvedic measures, those are time tested evidence-based and found to be very effective. And these are some of the diet guidelines which we could really follow in its own spirit as a wholesome diet concept of Ayurveda and also lifestyle modification. I must reiterate here that in our lifestyle modification, yoga, observing yoga for minimum 30 minutes and meditation and the prayer and the recreation for 1 hour is must, and we have that really gave the spiritual and mental wellness, and this is the concept of Ayur Yoga. That's what we are observing and trying to follow even with our Prince Charles Foundation. Maybe Dr. Amit Bhargav will throw light more in detail. And this is the yoga practice for the mental wellness. That's what we have added into our protocol. And along with diet, lifestyle, and yoga, these are the rejuvenating herbs which has become necessary part in the prevention, treatment, and post-COVID management, like ashwagandha, guruchi, avla, shatavari, and pitta dominant condition, turmeric, and the resin. And this is more important at a glance. If we want to understand what we did, it is the spreadsheet that is self-explanatory from morning to evening in all these various stages like pre-infection, gargling with the herb, guruchi, ayush kadha, that is a decoction herbal tea, sanshamanivati, tablets. It says when to take twice daily in asymptomatic conditions, in mild symptoms and moderate. Yes, we have restricted for treating to moderate symptoms, and this red zone, severe, we have integrated, we have the integration with the conventional medical doctors, and we have referred all those cases below 90, below 85 oxygen saturation SpO2 and dyspnea and respiratory distress. So when it is there, we have referred to higher center, but significantly we have been able to treat all these cases and more now. We have announced today itself that we have started post-COVID rehabilitation ward, and to all those post-COVID rehabilitation, we have added Avla, Giloy, and Gukshu as a Rasayan Churna, along with national protocol for post-COVID management, which includes Chavanprash and many others. And now coming to the largest cohort data, 80,000 police personnel, which we did with the tagline as a Corona se jang Delhi Police ke sang as a Ayur Raksha project, and the kit has been become more familiar, which includes all three measures. And what it really has helped, it has helped police personnel to prevent from the infection. The mortality is negligible, but more important, now I can say, because we have extended this benefit to the police families. So what police personnel tell us, that has developed confidence not in the police personnel, but to all their families, because these frontline COVID warriors, when they are outside on the road, when they take this in preventive kit, their family members really felt that they are safe. That's the strength we could really achieve in this preventive. And these are some of the care with compassion. This is, we are physically distanced, observing physically distanced, but we are mentally and socially connected. And what we could achieve is to give the human touch to each and every patient who has been admitted. Because when they say that, when I am discharged, I have become positive, that means my mindset has become positive. From positive, they RT-PCR more than 330, 80 patients now. 99% they have become negative. Their recovery time is really 5 to 6 days mean recovery time, minimized the hospital stay, and very importantly, all our healthcare workers, they are also observing. We practice it before we preach, and they also observe and they are safe. Mortality is zero, and the infection rate is also nil. And that's how we were blessed to have the blessings from our Honorable Minister, none other head of the family, to have one of the best care center with the compassion. Thank you all, and namaste and greetings on Dhanvantari Day from All India Institute of Ayurveda. under Ministry of Health. Thank you very much for patient listening.
Thank you very much, madam, for sharing your experiences and the various initiatives that you have taken from the All India Institute of Ayurveda for providing the prophylactic protection to the people, including the Delhi police and their families. At the same time, also initiating the various research activities. Now, I would like to invite Dr. Ross Zafonte and Dr. Ariana Vora. Dr. Ross Zafonte and Dr. Ariana Vora, they are from the Harvard Medical School from the USA. Dr. Ross Zafonte is a professor and chairman of the Department of Physical Medicine and Rehabilitation at the Harvard Medical School. He is also the chief of physical medicine and rehabilitation at the Massachusetts General Hospital, Brigham and Women's Hospital, and he is a senior vice president of medical affairs, research and education at Spalding Rehabilitation Network. Dr. Zafonte's laboratory work has focused on understanding the mechanism of the recovery after brain injury. Zafonte also serves in the leadership role for the football players, a healthy study at Harvard. He is the author of more than 300 and Dr. Ariana Vora is assistant professor at Harvard Medical School on the faculty of the Department of Physical Medicine since 2005. Dr. Vora began training in Ayurveda, Yoga, Acupuncture. She is board certified integrative and holistic medicine, sports medicine, and physical medicine rehabilitation. Dr. Vora is currently the co-chair of the American Congress for Rehabilitation Medicine, Complementary Integrative Rehabilitative Medicine Group. So I invite now Dr. Ross Zafonte and Dr. Ariana Vora for the presentation.
Thank you so much, Manoj. We are so pleased to be here early this morning and listen to these wonderful talks. I'm just going to go over briefly some of the COVID burden, and Ariana's going to talk, I think, more elegantly about our enthusiasm about integrating therapies that were just discussed into our world and how it may make an important difference. So I hope you can see my slides. And clearly, all of you have done a remarkable job discussing what is going on in the nation of India. In the United States, you can see this slide that is very, very, very clear. And that red line looks like just taking off rocket. In our country, we are very worried now because we have 120 to 130,000 cases a day, with some projections talking about over 220,000 cases a day very shortly, especially around our holiday season. We're worried about deaths, and the portfolio of who is getting COVID has changed somewhat. It appears a somewhat younger group of people who are then passing it on to those who are more vulnerable. And yes, we're worried about filling up hospitals and deaths, but I'm going to tell you a different story. I'm going to tell you for a second a story about long-term problems. And Doctor just touched on the issue of rehabilitation. So here are some risk factors that have been well known in the literature for higher hospitalization. They turn out to also be risk factors for long-term comorbidities. So it's not just someone passes away and someone is well, but there is a significant number of people who have long-term problems. The Italians have, even among the mildly symptomatic, over 30% with some form of problem. What are those risk factors? Age, body mass index of greater than 28. Some papers say 30, 35. In the United States, at least, those of diverse background. Prior cardiopulmonary comorbidity, kidney disease, diabetes, hypertension. There may be a risk in having a low vitamin D, and your blood group may be a risk. These folks have a six-fold risk of hospitalization, and we will show a paper fairly shortly that will show that these folks have a disproportionate level of comorbidities as well. So the issue becomes, how do we help people recover? How do we transform their lives after this devastating illness? And it's not the first one we've seen like this. As you elegantly touched, we've seen pandemics before and certainly treated people with sepsis before. So the way we think about this is that we have people in this pre-ICU phase, some of whom never get to the ICU, but still wind up with problems. Those who go to the intensive care unit ward, and then this new baseline that appears to last for a long period of time. We're doing a lot of work in this area and trying to understand what happens to people long term, their pulmonary status, their cardiac status. Many have cardiomyositis. Their brain, as I'll show, nerve, muscle, and the incipient issue, at least in our country, of behavioral health problems. All of which your therapies may be exquisitely well designed to at least begin to address, especially for those that are vulnerable. So this is a study from friends in the UK, and when we look at this, these are people with longer-term symptomatology. They talk about fatigue at a very high rate, breathlessness, anxiety and depression. There is a high PTSD rate, as I will show you. Pain, memory, and cognitive problems in the United States. This has now been termed brain fog for those post-COVID. And I show you this underappreciated element even in athletic people who are post-COVID and modestly asymptomatic, and that is this issue of cardiomyositis, where we see inflammation within the heart, and in some athletic groups, that's been as high as 30%. We also see brain MRI changes in many of these folks. Microbleeds, internal capsular and middle cerebral peduncle bleeds, and they look very much like other populations of people who have been on the ventilator. The stroke rate appears to be much higher. One report from China, 6%. In the United States, at least in Boston, it appears to be under 2%. But we're having many issues go on with these people, specifically related to their cognition. And that's just one portfolio of this. So if you survive the ICU or you survive a long disability period, what happens? Well, you know, this is a patient of ours, and you can see this MRI here of the lateral thigh. The person by chance had this MRI done pre-COVID and then subsequently post-COVID. Look at all the tremendous atrophy of the musculature. That atrophy is associated with mortality, morbidity, and poorer outcome. This muscle thickness appears to drop and drop very, very quickly. And it's affected by a lot of things that we do to people. Not only the sepsis and the microcirculatory problems and the vasculature problems that come from COVID, but neuromuscular blockade, giving people steroids, and potentially secondary denervation of their muscles. So what we have is a systemic disease that we're just starting to understand that does have some unique qualities and winds up with a population of people with a diverse series of issues. And then lastly, at least for my part, I'll talk about this burden because I think we're underselling this. Some claim that there's 20 to 25%, maybe more, of psychological burden from COVID. Some claim that the PTSD rate is 30% or higher. So we will pay a price for this pandemic for some time. And your therapies that we'd love to learn more about and be a part of studies with could be helpful, because if we can mitigate the severity, we can deliver something for patients. Next, I'm going to turn to Ariana and ask her to speak, and I'll change the slide.
Hi, everybody. Actually, Russ, I was hoping you'd keep going for another couple. Do you mind?
Not at all. Happy to do it.
I'll catch you at the end of. I'll catch you on slide 13. You're doing so wonderfully, and nobody could say it better.
So Ariana is overly kind. But what we have here is sort of Spalding by the numbers. So we are proud to be a partner with all of you. We are the #2 ranked rehabilitation hospital in the United States, the #1 training program. We have large services throughout an entire region of the United States, collaborations throughout the world, large number of publications, and one of the largest research funding operations of our kind in the United States. And in many ways, we seek what you see. We look to mitigate disease and enhance outcome for people with disability, physical and cognitive challenges who are at risk, but also the general community. This slide shows that we are focused on why we look at the biology of recovery. What are the things that we can do to mitigate secondary problems, as you are trying to do, and then see if we can restore function among those people who have had devastating sequelae. So if we look at this, this is an older slide, one of which is from one of the colleagues in Europe, another of which is from our group, looking at the translation of work in stimulation of the rat with a spinal cord injury to a translational element of this lady up and walking for the first time. So we have done work that is educatory, focuses in on advocacy and policy and knowledge translation. And that work really functions on a couple of different elements. One is our work in brain injury, spinal cord injury, stroke, musculoskeletal injury and pain, our center in COVID-19 discovery and recovery, which fits wonderfully with your work, and then various catalysts and research accelerators to try to take young people, where I think all the future is, and transform them in so many ways to vigorous and thoughtful researchers, to curious clinicians in these areas to make a difference. You know, this is the most recent pandemic, but it's clearly probably not going to be our last. And so, Ariana, I think you're on.
Thank you so much, Dr. Zafont. And thank you all for inviting us. We're just honored to be here today. And we wish you all the best on Dhanvantari Day, and really excited to share it with you. So as the previous speakers have said, you know, we are facing a tremendous burden of impairments that are related to COVID. And in the rehabilitation field, we're addressing impairments that have been a heavy burden in the human population before COVID as well. And we're always trying to investigate treatments in the rehab field that will facilitate intercellular communication, balance physiologic functions, nourish tissue, facilitate regeneration of target tissues, all things that are very well described in Ayurveda. And because Ayurveda offers perspective and depth for these problems that we're facing in rehab medicine, that's why we have a memorandum of understanding with the All India Institute of Ayurveda, and we're very honored to share that relationship. Here we have some pictures of the signing and the letter in New Delhi, and when Dr. Nasri and Mr. Tiwari came to Spalding to visit with our leadership. And some of the things that we are looking toward from learning from Ayurveda is the Ayurveda perspective on Udarka. That is something we can learn so much from in our system, because we're facing such long-term damage in various systems, as Dr. Zafont has described, and as Dr. Tanuja Nasir has also described, in response to disease, in response also to other insults, also degenerative disorders outside of COVID-19 as well. And also the concept of Rasayan is something that could be so helpful in the rehab field as we try to achieve some tissue regeneration in degenerative impairments and age-related impairments, and pertinent to today's topic, immunomodulation. how might we enhance host immunity, reduce the cytokine storm that is associated with tissue damage and fibrosis? How might we augment a vaccine response? So we already have a strong integrative health group at Spalding and are really excited to bring this forward in the Ayurveda direction. So next slide is just some information about Guduchi that we find particularly intriguing. And as Dr. Tanuja Nesri and Manoj Nesri were saying, the importance of just the depth of looking at the host, the person that is encountering the pathogen, and how do we facilitate the healthiest kind of person that can respond to these challenges, not just attacking the virus, but looking at this from a multimodal perspective. And you see on the right study, a really interesting in silico study looking at the actual molecular docking, where you can see that Tinospora cordifolia, for example, Guduchi, has a tinospinone compound that has a very high binding affinity for the 3CL main protease in COVID-19. And it could therefore be a potent inhibitor of that protease, which could be very, very promising. I know we're going to hear from a later speaker more about these in silico studies, which is very exciting. And on the left, a really just amazing view of the various immunomodulatory actions of Guduchi. And I mentioned Guduchi because it was one of the key medicines in the police officer study, and it's just something that we're looking at for the future, as we'll get into. But the proliferation and differentiation of B and T cells, the action on the leukocyte count and macrophages is really quite impressive. So on the next slide, you can see just a summary of the various actions on interleukins of Guduchi. And on the left here, just recognizing Upadhyay's research on the in vitro studies showing that the Guduchi actually improved the phagocytic ability of macrophages, enhanced nitric oxide production by splenocytes and macrophages. And on the right, you can see these two graphs, how the right one is exposing the cells to Guduchi. The lymphocyte response was much earlier and much better. So really interesting about Guduchi. On the next slide, I just wanted to show you, this is the 4 herbs in the Guduchiari formulation that All India Institute experts and have developed that we are really excited about. So I mentioned about Tinospora cordifolia or Guduchi, and we've been hearing about the sequela in terms of cardiac disease and pulmonary fibrosis, fatigue. And so we are really looking forward to collaborating with the All India Institute of Ayurveda colleagues that we are very proud to have. And we have been having some planning meetings with Dr. Patak and Mr. Tiwari and the Dr. Manoj and Tanuja Nesri to plan a study where we aim to enroll outpatients who are recently diagnosed with COVID-19 in Delhi and Boston with the aim of reducing complications, perhaps reducing duration of symptoms and hospitalization, and also looking at biomarkers and laboratory tests and other clinical outcomes. And finally, on my last slide, I just wanted to talk to you about some opportunities to enhance rehabilitation with Ayurveda. There's so many research possibilities examining clinical, functional, and biomarker outcome measures, and not just on a single herb or a combination of 4 herbs, but on various Ayurveda treatments. For example, we have a neuromodulation lab, and we are doing surface EEG work at Spalding, and a study of Shirodhara for neurorehabilitation, looking at clinical surface EEG and biomarkers would be just a wonderful study to do, and really relevant for COVID-related issues and beyond. Panchakarma for musculoskeletal pain. We have enjoyed putting together a study pre-COVID, a population study design with our colleagues at All India Institute, which has now been on hold with COVID, but we hope to pick that up again. And we also have a study that was recently funded looking at Vata Vyadi disorder, specifically the effect of Rasayana, Apyanga, and lifestyle practices according to Ayurveda, and what their effect might be on platelets and gene expression prior to orthobiologic treatment of osteoarthritis, looking at clinical outcomes, interleukins, and gene expression, and other Vata Vyadi disorders that we see that are well explained in Ayurveda in a way that we are not trained to look at in biomedicine. So we would love to see further exchange of clinicians and scientists and educators. Here we have a picture of Dr. Manoj Nesri with our integrative health team at Spalding. We would love to put together a center of excellence for integrative health with research, education, and clinical care pillars. And for now, we're looking forward to further exploration of the Gudusyadi formulation for COVID-19, and really would like to explore how we might use the wisdom of Ayurveda toward tackling these post-COVID-19 rehabilitation challenges that Dr. Zafan has covered, and we hope to do this with you. So thank you so much for having us here today, and best wishes to you all on Ayurveda Day. Thank you.
Thank you, Dr. Zafonte and Dr. Ayana Vora, for sharing your slides and the work that you are doing. At the same time, you also ignited the thoughts among the participants about the various possibilities of research collaborations and how the strengths of Ayurveda and the strengths of Spalding rehabilitation, so they can be united, and how we can work together. So we look forward for more and more research together. So thank you very much. And also thank you for actually keeping there till late night, rather I would say the early morning. So thank you very much. And we look forward for more and more cooperation in future as well. Now moving ahead, I would like to invite Dr. Mohammad Aslam from the Department of Biotechnology. Dr. Mohammad Aslam, he is a scientist and the managing director of BIRAC, a platform to promote biotech industries in undertaking biotech-related research. He is the advisor and in charge international collaboration, Department of Biotechnology, Government of India. I invite Dr. Mohammad Aslam from the Department of Biotechnology. Dr. Aslam, are you there? I don't see the name of Dr. Aslam in the list of the participants. Dr. Suniti, please contact Dr. Aslam. In the meantime, we'll go to the next speaker for this today's. Dr. Suniti, are you there?
Yes, sure, sir. I'll contact you.
Yeah, please contact Dr. Aslam. In the meantime, we move forward. The next speaker is Dr. Mitali Mukherjee from the CSIR. She is a chief scientist, genomics and molecular medicine at IGIB. IGIB is the Integrative Genomics and Institute of Genomics and Integrative Biology under the CSIR. Dr. Mitali Mukherjee, she is the pioneer in the field of Ayurgenomics, and Dr. Mitali's name has become synchronous with the Ayurgenomics, the term coined by fusion of the two words Ayurveda and genomics. Dr. Mitali is a recipient of the prestigious Shanti Swarup Bhatnagar Award in the year 2010 for her contribution in the field of medical sciences. And the IGIB is also the partner with the Ministry of Ayush, and we have close cooperation with the Department of Science and Technology and the CSIR. So now I invite Dr. Mitali Mukherjee to share her research on the COVID through Ayurveda.
Thank you, Dr. Anil. Am I audible?
Yeah, you're audible and your slides are also seen. Thank you.
Good afternoon, everybody, and greetings for the Dhanvantri Divas. And also, I'm honored to speak in this August audience. Actually, I'm speaking on behalf of CSIR. Our Honorable DG could not, for some reason, was not able to make it. So I will be presenting the research of Council of Scientific and Industrial Research in the area of Ayurveda, or usefulness for integration with Ayush system for the COVID pandemic. So, as has been elucidated by everybody, that COVID pandemic has more now highlighted the need for integration with traditional systems, because we are now coping with different viral strains, different population heterogeneity, mortality rates are different in different populations. Lots of things have been ascribed to different geoclimatic conditions, and even if people are positive, they are differently presenting with either being asymptomatic or having some mild symptoms to even mortality. And this kind of a heterogeneous spectrum in a disease, which is very, very new, because it's a zoonotic origin and recently originated, has sort of cripple the entire medical community, and we are looking for different kinds of ways by which we could approach it. Now, in this context, I could mention that for Ayurveda doctors, I think every disease is a new disease if they have to contextualize it with their textual description. So that way, Ayurveda has a generic framework, and there is a possibility that having an understanding of the disease in the phenotypic perspective, as well as the following the phenotypes over long sequelae, might actually allow addressing the challenges of differential outcomes, how we can prevent adverse outcomes by understanding heterogeneity in disease, how can we evolve better treatment modalities looking at the evolution of the disease in a person, and also these long COVID and reinfections which are coming up as many uncertain aspects, and also how to enhance the host immune system to be able to kind of withstand the viral infection. So in this context, Council of Scientific and Industrial Research has also joined hands with Ministry of Ayush for jointly working in areas of research and education for not only traditional but also towards integrative medicine. And the idea is that so there is a working group now with scientists from CSIR institutes and people from Ayush, experts from Ayush. And the idea is if we could provide a clear understanding and have more value-added products, which is from the combination of Ayurveda sciences with modern sciences. To the next slide. So the objectives have been manifold, but primarily it caters to how we could provide R&D support, help in development of diagnostic tools, link omics with Ayurveda. Also, we have a very strong hold on the natural product chemistry, so how we could actually integrate them with the ongoing research and optimally use facilities across to have a better interdisciplinary approach. So, if just to let you know briefly, CSR labs are all across the country, and then there are certain labs which are involved in different activities for from medicinal plants to herbal drugs and phytopharmaceuticals, for extraction, for making extracts, GMP grade, how to integrate modern sciences, and also with the nutrition. And we also have these databases, traditional knowledge digital library. So these are all the basic aspects, and have these strengths in the times of COVID, how we could leverage on these strengths from various sectors of CSIR to be able to enable faster or augmented development with Ayurveda for medicine or for better health of the people. So just to briefly say, there's this traditional knowledge digital library which holds the digital knowledge base of foundations. This is in partnership with Ayush. It's been an ongoing project, and there's a natural product chemistry wing which does a lot of virtual screening, have libraries, chemical libraries. We have capability for synthesis, so as a result of which small molecule synthesis can be done. And then lots of models are there for in vitro, in vivo study. We have multi-omics platform where we have been using it very extensively for understanding COVID genomes and the transcriptomes. And also we have a unique framework of Ayurveda, which I have over the years co-developed with Dr. Bhavna Prashar. She's an MD in Ayurveda, and we've been working together for the last 2 decades. And then the way the Ayurveda stratifies people in cohorts, and also a unique platform of connectivity map for, especially for Ayurveda formulation. We also are considering COVID to be able to screen products and have initiated research in metagenomics. Now, all these strengths are being leveraged for understanding host and viral response, and also Ayush has recommendations which we are trying to kind of augment with helping with the clinical trial, and also the leads from polyherbal formulation we are iteratively having a crosstalk. So the TKDL, that's a traditional knowledge base, has provided a lot of medicinal herb information which could be used for COVID-19, and some of these leads are being proposed by different labs for COVID management. So this is one aspect. We have also developed the kind of know-how as to how to get a phytopharmaceutical. It's like akin to botanicals under US FDA, past all the regulatory regime. That has been a big task, and using this during COVID-19 in partnership with another institute, ICGB and CSR, IIIM. We've been actually screening, a drug screening is ongoing across cell centers. There's this unit of Trisutra, which we've established based on our research from 2002 onwards, which looks at and stratifies people across the country. For basically, we've developed methods for phenotypic stratification, which is going to be very important now in understanding inter-individual variability in Prakriti. And based on this, we have also developed a multi-omic framework which could enable us to understand molecular correlates of dosha, which Dr. Mestri had mentioned is important to understanding Prakriti and Vikriti in diseases. So this unit is housed at ICIB, and we've been in partnership with lots of clinical partners of Ayurveda. Have been looking at thousands of people and trying to develop protocols. There's this connectivity map platform. So MIT Broad has a connectivity map platform which we are leveraging for the signatures, and we are trying to use the same platform to query the mechanism of Ayurveda formulation, so that we could understand the mechanisms by intersecting with the known signatures, and also try to see if we could integrate with COVID signatures, whether we would have a better understanding of what Ayurveda formulations which are recommended could be working in what way and how they can be repurposed. Clinical trials for a couple of formulations are ongoing. I need not emphasize the importance of Enospora and Yashvi Madhu and all, which the experts over here are aware of, but we've been enabling, and we've been working with Ayush for prophylactic as well as therapeutic trials across the country. And the other part, which I'll just briefly mention, because this is a part which has happened with us, our institute, and now it is we are taking it forward in partnership with All India Institute of Ayurveda. We work for developing a new framework for exploring the therapeutic aspects of Trisutra for network medicine, which is a little different from what is the phytopharmaceutical route. Basically, we look for imbalances, signatures, and based on the imbalances signature in an individual specific manner, we understand the routes of intervention. So once we identify imbalances and their molecular signatures, we create Ayurveda drugs which are described to manage those imbalances in particular disease conditions to be able to see whether we can get the system back to homeostasis. We've tested this with respect to a hypoxia axis, which we discovered through constitution type, developed models, and showed that how severe asthma models which recapitulates the hypoxia axis could actually be intervened by a drug which modulates this axis, Adatoda vasica. This has been led by Dr. Bhavna Prashar. And now we are using this framework to kind of look for whether this can be, once we find that it works on a hypoxia axis, whether it could be repurposed using this component of Trisutra framework. So we have a medicinal plant. We look at the metabolites in there. We try to use docking methods, and at the other end, we look at from different model systems, try to synthesize the information and see whether we could arrive at something new. Discover in multi-dimensional Adatoda vasica in preclinical mouse models. So SARS-CoV-2 has evolved through different stages, and we find that using our preclinical models, there is a scope for this to work at the stage of recovery, at the stage of severity. So we have looked at the effect of Adatoda vasica at the level of expression, at the level of genetic, at the level of cellular, at the level of tissue, at the level of phenotype, which are the hallmarks for COVID-19. And when we study all these in different kinds of models, for example, the lung transcriptome, fibrosis model, fecal ligation, these are all models known for different kinds of indications like sepsis and cytokine storm and other kinds of things. We find that using this medicine or herbal formulation is able to alleviate different dimensions, which tells us that, in summary, that this Adatoda vasica could actually be maybe repurposed in certain conditions where hypoxia becomes consequential to inflammatory outcomes. So we've looked at the extract, looked at the alkaloids, and identified that these are the compounds, tested them in a severe model of asthma in epithelial cells, as well as looked at various models of fibrosis, thrombosis, sepsis, and looked also at the patients of COVID and identified that this could actually be intersecting with the places where signatures of COVID are higher. The drug seems to have a negating effect. This has been recently is in review, but we put it in Research Square, so the more details are over here. This was led by Bhavna, and then based on this, in partnership with All India Institute of Ayurveda, Ministry of Ayush recommended we could take this to a clinical trial. So we have designed with Dr. Tanuja Nesri at the helm at AIAA, and there are other co-investigators, Dr. Meera and Dr. Vitul and other co-investigators, as well as investigators primarily led by Bhavna and us at IGIV. We are looking at the way Adatoda vasica could it be useful in therapeutic management of positive asymptomatic or mild symptomatic cases, and we could look at the rate of viral clearances using genomic methods, and we are also using comparator as a guru key. So we have developed a very detailed protocol, which is a combination of Ayurveda and modern parameters, and got it ratified and reviewed. And we've just initiated the trial, and we've started recruitment. All the SOPs have been laid down. And if this kind of a thing holds true, then we actually have a framework to take many of these through pipeline. The other one is Cesar plus Ferreira, which I said through connectivity map and through looking at COVID transcriptome of patients, we've been able to identify what kind of pathway, because Sesam plus Pereira is used for dengue and women-related disorder, and we could actually discover that there are lots of interventional points where COVID-related small molecule drugs are known, and the CIPA, that's the Sesam plus Pereira, has actually opposite signatures, meaning that it could be possibly also working like the single molecule drug. But nevertheless, this is a multi combination of a monoherbal formulation, so it could actually work in a synergistic manner. And we are very excited because we also found that it also links with the estrogen axis, which is coming up quite prominent in COVID disorder. And along with a partner from IHBT who have developed the entire phytochemistry of this and have also done anti-malarial activity and all, we are trying to propose that this could be also one of the key candidates, because this is also one of the Ayush recommendations called PATHA, and maybe this in conjunction with other medicines could be useful. So Ashwagandha, I'll not get into the details, but it is a very prominent. CSR has spent lots of years on developing lots of expertise around this, and in partnership with AI with Ayush, we've also started a clinical trial for prophylaxis across the country. Guruji, that is Cora and Piper, again with a joint partnership of CSR and Ayush, we started. And Yashti Madhu, again a third one, which has also got potency. This is also started as a clinical trial across the country. So these are all in partnership with, and already the patients recruitment has started on. And I'll just end with the last slide, that the one thing which is missing at the modern context is the inability to stratify patients, and we feel that Prakriti has a lot to offer stratification. Earlier, we have shown hypoxia response to be involved in a Prakriti specific manner. Then we have looked at thrombotic outcome with hypoxia is different in different Prakriti. This tells us that integration of Prakriti method or looking at Prakriti of people in a long term might also provide lots of clues as to how to kind of keep those balances in check in an individual specific manner. We are happy to say that the Ministry of Ayush is supporting us in this endeavor. We have a Center of Excellence, and through the Center of Excellence, we've been able to use our methods, which are also ratified by lots of AI and machine learning tools, for dissemination or training the trainers across the country in the Ayushman Bharat Health and Wealth Centers. Prakriti Health Cards are likely to work through our protocols, and that gives us an enormous opportunity now to kind of increase the base for such studies. So Bhavna recently held a training of trainers. 200 trainers got trained for Prakriti method, which is also actually within a month spread out, and the trainers have gone and trained further trainers in different parts of the states of the country, Madhya Pradesh, Patna, and in Haryana, and this is likely to have a cascading effect. So we are very upbeat. Any of these supports of the basic sciences which goes on into translation actually, I think, is very heartening, and sort of tells us that there is a lot to do and lot to achieve. Thanks all. I will close now.
Thank you very much, Dr. Mithali Mukherjee, for giving an extensive outline about the various activities being undertaken by the CSIR and about the collaboration between the two institutes and your work about the various medicinal plants. Thank you very much. Now, moving ahead, I would like to invite Dr. Rajendra Joshi from CDAC. He is the Senior Director and Head of the Department, High Performance Computing, Medical and Bioinformatics Application Center for Development of Computing, that is the CDAC, Pune. He has associated with this area of biotechnology and bioinformatics for the last 28 years And recently he has done a lot of research on the Ayurvedic medicine plants, and some of the research they are on the verge of publication. So I would like to invite Dr. Rajendra Joshi for his research through the bioinformatics on these Ayurvedic medicine plants. Dr. Joshi, please unmute yourself.
Yeah, can you hear me now?
Yeah, now it is.
Okay, sorry about that.
But now your slides are not seen.
Okay, just a minute.
My
Can you see
also
that?
request, yeah, now it is visible. My request to all the speakers is that just to keep in mind the time frame.
Yeah. Can I start?
Yes, yes, please.
Yeah. So I'd like to thank Dr. Nesuri for giving me this invitation. I'm in fact Rajendra Joshi. I'm a computational biologist. So I'm really an odd man out in this meeting of very experts, high experts, highly experts of various streams in Ayurveda. For last 25 years, my group is working on computational drug discovery, and we work on various aspects of various diseases. Our main focus has been on cancer, and we have been trying to look at various molecules which can help in curing cancer. In fact, when COVID-19 hit the entire globe, we thought that we should take this opportunity to use our expertise in the last 25 years or so to see whether we can really contribute in this domain, and trying to see new drugs that can be discovered to control the pandemic. We have been looking at various aspects. One of them is definitely the FDA approved drugs, which we are looking at. And being in India, we thought that we must also look at our own traditional medicine. And because I personally believe that Ayurveda has a lot of hidden secrets there, which can probably answer many of the health issues of the world. So I'll just give you a very small brief about what we have been doing on trying to look at Ayurvedic molecules, basically the phytochemicals, with an approach of computational drug discovery, and where we use high performance computing, trying to see how we can accelerate drug discovery and take it to the next level. So my title of my talk is trying to see how you use in silico approaches for these Ayurvedic molecules, which could be potential drugs, because this is finally on the computer. We do not do any wet lab testing, and so that we can try and combat COVID-19. As you all know, I think COVID-19 virus is now quite well known over the world, and it has roughly about 20 proteins which are there. It shares a lot of homology with the previous known RNA viruses. There are a number of groups all around the world which are targeting various proteins. Some of them are very well known. I'll talk to you a little bit more about them in the coming slides. As I said earlier, my group has expertise on drug repurposing, and basically computational drug repurposing, I mean. It essentially means that when you look at a FDA-approved drug list, which have been designed for specific diseases, those same drugs could be used for a different disease, by looking at repurposing. And when you're actually looking at computational repurposing, you are actually trying to model these proteins in the three-dimensional structure, and trying to understand how these protein molecules interact with various drugs. And that's how probably you could land up with drugs which you can discover much faster. So something which takes you typically around 10 to 15 years could take you just a few months or less than a year, kind of a thing. So my group's interest was to look at the mechanisms of action rather than just at the overall level. So we are trying to see how we can find out what are the exact mechanisms of action of these phytochemicals which are from plant sources, and how they interact with various protein targets on the COVID-19. As well known, I think Ayurveda has a very rich source of plants and herbs and spices and those kind of things. I don't need to go into details of that. There are more than about 1 lakh different plant-based compounds which exist from various traditional medicines, which are there. We are hypothesizing that probably this rich source of information and which is there already available in India, could be used for many antibacterial and antiviral activities. And by using computational methods, whether we can actually show that yes, these kind of molecules really interact with those plant targets, which typically in a normal drug discovery mode, it's done. So our approach and thinking is basically trying to look at high performance computing driven drug repurposing. And HPC is required because there are enormous amount of computations which need to be done. More number of molecules, more number of computations. And of course, our interest was to look at Ayurvedic molecules in the COVID-19 drug targets, and of course the mechanism of action of the Ayurvedic molecules. So basically, what we have done is we have picked up three of the main proteins targets which are there. The main protease 3CL-Pro, the RNA-dependent RNA polymerase, and ACE2 spike protein which is there. I think we would like to, the idea here was to look at the entire set of phytochemicals that are present in the plant sources, trying to see and dock them to these particular proteins, and then see what kind of results we get. So idea here is the drug repurposing against Ayurvedic compounds, where we look at the Ayurvedic compound database. You take them one by one, dock them against the COVID-19 drug targets, throw them onto the supercomputing clusters which CDAC has. So we do a massively parallel docking exercise on these clusters. And once these computations are done, they are taken back and then taken back for the analysis to see what exactly the results are. So the flowchart is something of this kind, where we in fact built our own Ayurvedic phytochemical database. So we did a lot of survey on the Indian medicinal plants, and specifically we picked up those molecules which have been involved in respiratory diseases. And by looking at the list of the phytochemicals from these Indian medicinal plants, you actually look for the structure of it, because many of the papers do not have the structure of those molecules. So by using the CAS and the PubChem and the drug bank, you look at the structures of those particular molecules, extract those structures, create a small database, and those databases were actually then screened for activity for docking against those particular protein molecules. Now, docking is a very compute-intensive exercise, and it takes a very long time, and many of the systems are more than 1 lakh or 2 lakh or 5 lakh atoms, depending on what kind of protein you are trying to simulate. And by using high performance computing, CPU driven, both GPU driven and CPU driven, we were able to do molecular docking followed by very advanced level simulations. And the GPUs, in fact, we used a very large set of GPUs, something like 80,000 cores of the GPUs to do these computations and try and come to the results. So we did a lot of simulations. I'll take you into some of the things. We did some work on the FDA approved drug, where we actually got ivermectin, one of the well-known drugs which is being used now for treatment of COVID-19. In fact, this was published in Journal of Biomolecular Structure and Dynamics. We also looked at, in fact, our result on ivermectin was actually kind of recommended also and validated through this paper, which actually says that yes, it does inhibit the COVID-19 virus. We also did a lot of work on remdesivir, for example, and remdesivir, in fact, binding. This paper, in fact, we published in Royal Society of Chemistry. This was one of the very hot articles which got cited all over the world, and this is how the binding actually happens, where you have the RNA template entry site for viral replication, and actually you can actually do the simulation and see how remdesivir binds onto the RDRP. And in fact, this was again well known. It is now currently being in therapy. I think remdesivir binding to the protein RDRP is now well established. And in fact, this was, as I said, published in Royal Society of Chemistry. So these two exercises really gave us confidence that the methodology is really correct. And then we looked at the Ayurvedic phytochemicals. where we looked at the ACE2 spike complex, and then you do ensemble kind of a docking where you generate structures of various kinds, dock them against the Ayurvedic phytochemical databases, which are about 250 number, and then of course we got very interesting results out here, where we looked at neem extracts, ashwagandha, kaduchiritya, and kala mega, etc., which we got as positive results. These actually structures show you the actual binding of the Ayurvedic phytochemicals to the protein, the spike protein, and in each of these cases you will see the common name ashwagandha or kaduchiraita and pimpali that we see actually binding to these to these molecules. This work was also published into the archive, basically, and this is being cited quite heavily. We did a specific case testing of Gulwel. Gulwel, as you all know, has a mixture of some very interesting compounds. Some of them are listed out here. I'll not go into the details. And very interestingly, we saw that when you are actually doing a binding of Gulwel, carbofoliad A, basically phytochemical, by using a very advanced molecular dynamic simulations on the GPU clusters, we are actually able to see the way it binds very intensively to the protein, to the 3CL protein. Similarly, the RDRP protein, the cardifoliate basically is actually binding to CPU and GPU on these CPU and GPU clusters, binds very intensively to the RDRP. And in fact, the binding sites are very similar to the remdesivir molecule. And that's something which is we found very, very surprising, because remdesivir binding has been very well established, and we have a phytochemical which is going and binding exactly at the same point. Similarly, we did this exercise with ACE2 spike. We did Gulwel on ACE2 spike, and we again got very good results out here. These results are in fact on the in the process of getting published, and so I won't be able to share more details out here. We have done a lot of simulations on the practical use cases, where we looked at main protease as well as RNA polymerase. We have got very good sources of compounds from the Ayurvedic source. And some of this, in fact, all this work is now currently being published, and it's under review. And we feel that many of these molecules which are there, the phytochemicals, can play a very important role, and we are able to explain the mechanism of it more importantly, because I think one of the important things to, which will be a big boost for Ayurveda, is trying to show that these molecules are really at the molecular level binding to the protein targets and making a good effect. So essentially, we are looking at a possible way of our future work is an all-to-all kind of docking of all the possible Ayurvedic phytochemicals to the various protein structures of COVID-19. And this protocol is highly scalable, because the more compute power you have, you can actually come out with more possible drugs. And of course, one of the limitations is that this has to be validated experimentally. So if anybody in any of our colleagues on the call would be interested to collaborate, we will be very happy to kind of do these computations for them. And of course, this is the kind of work. In fact, Ayush Ministry had kind of announced that the COVID-19, these are the molecules which will be very effective, and we actually got these molecules very effectively bound and docked to the protein targets. And so this is a kind of a confirmation that at the molecular level, these molecules are actually working, and kind of a confirmation about the activity of these molecules. This is some of the future work that we plan, whether you can also do mixtures of these molecules, docking of the mixtures of the molecules, because normally Ayurveda says that it's a mixture which works, not the individual molecule. So we can actually do these mixture of molecule docking onto the system and then see. And of course, this is one of the future plans that we have, trying to look at drug repurposing for Ayurvedic molecules, not just for COVID, but all possible. Of course, not just for 3 of those targets, but all the possible targets of COVID-19, and of course, not just COVID-19, but all the possible diseases. So that's the way I feel that we can help in a small way to bring Ayurveda into the forefront. And of course, we have got a lot of testimonials, right from the Royal Society of Chemistry to our own ministries, Ministry of Science and Technology, Ministry of Electronics and IT. And our funding is mainly the National Supercomputing Mission. I would like to thank them. And thank you very much.
Thank you, Dr. Joshi, for the excellent presentation. And you were definitely not the odd man out. Rather, I would like to refer to the address of the Prime Minister, where he mentioned about the Ayur chemistry and Ayur physics. So obviously, this is the Ayur computing,
Sure.
and this is as per the actually the directions of the Prime Minister. And I would also like to draw the attention to this Sushruta's phrase. It is Ekam Shastram Adhyano Na Vidya Shastra Nishayaha. That is, just by learning one side of the science, you cannot understand the whole thing holistically. So we have to use all the various sciences possible. And definitely, we will like to have more collaboration with the CDAC to have the more research on this. So thank you very much.
Sure. Thank you.
Now proceeding to the next this one, the CCRIS, that is Central Council for Research in Ayurvedic Sciences, has also done the extensive research on these various aspects of the COVID, which is preventive aspect, at the same time it is the treatment. And I invite Dr. N. Srikanth, the Deputy Director General of the Central Council for Research in Ayurvedic Sciences, to present his work. Dr. Srikanth, he is an Ayurveda expert. At the same time, he has extensive experience of the research with the CCRAS, and currently he is the Deputy Director General of the Council. I would like to invite Dr. Srikanth, and with the request to limit your presentation to 10 minutes, please.
Thank you very much for inviting, sir. I will put a brief glimpses on the initiatives of the research and development of the Central Council for Research in Ayurvedic Sciences, particularly on COVID-19 management. The core activities what we have undertaken is clinical studies of Ayurveda intervention as standalone and add-on therapies. Second one, prophylactic studies. This is studying the impact of Ayurveda-based prophylactic interventions like Guduchi, Sudarsana Ganavati in high-risk population and containment zones. And some in silico studies, only one study for I-64 in collaboration with the National Institute of Nutrition, Hyderabad. And also retrospective observational studies of the research outcomes already conducted by different states and different colleges. These are the core activities. The activities are mainly based on the recommendations of the interdisciplinary task force and also availability of the quality standards and preclinical safety studies, and rational based on the Ayurveda as well as the current pharmacology and other activities. The total studies we have undertaken is 23 studies, out of which 18 has completed and few are ongoing. Out of them, we have taken the studies of prophylactic studies, particularly on 8 containment zones, and studies on the healthcare professionals core studies, and add-on standalone studies 7, and add-on therapy studies 3, and 1 molecular docking study. The prophylactic studies mainly we focused on the Ashwagandha, Guduchi, Sudarsana Ganavati, a classical Ayurveda formulation, Chavanaprash, and some Ayush Raksha Kit or multi-formulation interventions, that is 5 studies. Add-on or standalone treatment, where we have focused on I-64, Guduchi Ganavati, that is Stenospora cardifolia, Guduchi and Pipali combination. This is in collaboration with the Vedanta Hospital, and also Ayush CSIR study also, this is there. Ashwagandha and Santi combination. If I put the brief interim trends of very few studies, that is, one is Guduchi Ganavati and Sudarsana Ganavati, Ashwagandha we have tried in 6 containment zones in Delhi in 1500 population, and this has shown very good protection rate. Only 99% protection rate we have seen, that only 1 out of 1500 become actually turned positive. When compared to that period of the incidence in Delhi, that is 4.15%, this has only seen 0.6% incident rate is there in the study group. The another study is a similar study, which is we have taken in 15 institutes of CCRS in across 19 cities in the country, taking I think 30,000 population. and 10,000 control group and 20,000 intervention group. Control group, we have given the advocacies, normal advocacies, which are given safety measures. And in this, after 15 days, we have observed that the influenza-like symptoms, we have seen only 30.30% of the population who consumed Ayurveda intervention, when compared to 60%, we have seen that the another group which are giving a standard normal care. This is another study which are focusing on the Vidhania somnifera. This is non-randomized open label interventional study. This is conducted in 3,600 participants in Hyderabad. And in two groups, we have taken 1,800, and only 5 participants who became positive, who are there in the group who are consuming the ashwagandha. While in another group, which is the control group, 13 patients became positive after 45th day of the follow-up. And the important thing here, we can see this, we studied the QOL brief for COVID-19, which is very significantly seen in 97% of the participants who consumed Vidhania somnifera, and compared to 87% in the control group. And the general well-being also, the scales we have seen in 98% of the participants has shown has shown good health status when compared to the 78% in the control group who consumed Vidhania somnifera. So this is another study, which is a non-randomized open-label control study. This is also in Tinospora cardifolia. This we have taken 1,800 subjects, 900 in each group. And here, the scene is, we have seen the 100% protection rate in 100 participants who consumed Tinospora cardifolia. And the another group, we have seen few patients, 10 cases, we have seen positive after the 30th day of the follow-up. That's why this is giving a good prophylactic potential. And this is another study, which is a compound interventions, that is multi-drug interventions, Chavanapras, Samsemnivati, and Haritaki. This is given in 1,500 subjects, 750 subjects in each group. Here, we have seen that only 2 out of 750 participants who become COVID positive, while when compared in 45th day, when compared to the 15 positive cases in the control group. That's why this is also giving very good protection rate and of the compound interventions of Ayurveda. This is another study, which is these are the few studies which we demonstrated this is another study that I in collaboration with government of Telangana and I-64, Guduchi, Ganavati, and Chavanapras. These were the studies we have started much earlier. That's why 500 subjects we have taken, 250 in each group. We have seen that the Ayurveda drug group, we have on 45th day of follow-up, we have seen that none of them becoming COVID positive. Well, in control group, we can see that only 2% of subjects we can see that COVID. That's 5 cases we have seen. Then this is another study. These are this is the prophylactic studies what I have shown you. I will put 2-3 important studies which we have given, hospital-based studies for the mild to moderate COVID cases. This is a collaboration with Vedanta Hospital, which is a tertiary care corporate hospital in Delhi. We have taken Guduchi and Tripoli combination. We have taken in 60 subjects, 30 in each group, control as well as the treated group. Here, this is also a study which we have started much earlier. And here the thing is the subjects who have consumed Guduchi and Tripoli, none of them has progressed into the severe stage of the disease, besides improving the quality of life. That is one thing. Second one is the mean days of the hospital stay is in the standard control group is around 6.5 to 7.3 days, while here it is around 5 days, 5.4 days. That when it is reducing the stay of the hospital with a good survival score of reduction of the symptoms in the less hospital stay. This is another study which is conducted, single arm outcome based study. This is the I-64 in Ayurveda and Tibia College of the Delhi we have taken. This is sample size is 40. This is outcome-based study, and this is started a much earlier study. This we have taken, and in eighth day, up to eighth day, that all I-64 studies have demonstrated that RT-PCR is becoming negative in an average in between 7 to 8 days. This study also, most of the patients become 70.2 RT-PCR negative at the end of the 7th day. While on the 15th day, we can see the total patients are symptomless. They recovered clinical recovery besides RT-PCR negative in all subjects. This is another study. This is also a single arm outcome based study of the I-64 in Charak CB PATS. It is a tertiary care Ayurveda hospital in Delhi. The study, we can see this is also in 8th day, an average, more than 50% of the subjects become RT-PCR negative, while 69.4% we can see after the 15th day. But the other parameters, interleukin cytokines, we have done all studies that we are analyzing those things. Thus, this is well tolerated. Sir. This is another study, which is the efficacy. This is also I-64 study, which is done in collaboration with Government Ayurveda College, Nagpur. And this is a good study here. Though there is no much difference between the recovery in 7th day in control group of standard care as well as the add-on I-64, that is 62.5% when compared to 60%. But the survival function analysis and quality of life indices has very good. We can see that very good improvement from symptoms, that is in 30% of the subjects in the trial group and in 20% in the control group. Still, we are analyzing. This is another study which is very promising results in Madhya Pradesh. We have CCRS has done in collaboration with Kushilal Government Ayurveda College, and we have given this is only for 10 days, 15 days intervention given. But here the groups we have, one is standalone Guduchi has given in one group, and CQ has given in another group. And here, after 10 days of the intervention, that RT-PCR becoming negative, we can see besides clinical recovery in 93.3% of the subjects, when compared to 66 subjects in the control group which has taken. But no ADRs we have seen here. This is not a add-on. This is a standalone Guduchi compared with HCQ. This is another study. We can take in the sample is 80 and 40 in each group. This study we have seen, we have done in Dhanvantari College in Chandigarh. These subjects we have seen that the I-64 has taken that they have become. This is very early study. 23rd day we observed that 97.3% of the subjects has turned to negative in the standard control group. Why none of them become they 100%. They've never become negative in the I-64 group, and this is also we are analyzing. This is another study we have taken Samchamanivati and a study which is 1 to 15 years of age, and I-64 in the subjects above 16 years. This is also clinical recovery we have seen in 5 to 7 days, and no with RT-PCR negative in 5 to 7 days, but no relapse of the symptoms. This study, which is going now, and in collaboration with the Council of Scientific and Industrial Research under ICSAR initiative at KGMU Lucknow. It is a tertiary hospital, Dattamege Institute of Medical Sciences Nagpur, and CCRS Institute in Mumbai. And the interim trends are encouraging. Still, we are just completed. We are analyzing. This is one of the most important study to assess the health-seeking attitude and impact assessment of the Ayurveda Ayush intervention, particularly through Ayush Sanjeevani app, which is already detailed by our additional secretary, sir. Here we have seen that 15 million, 1.47 crores of population has been responded. Here, the beauty is more than 89% of it, about 90% of the respondents who used Ayush interventions out of the respondents have given that it is having very good response actually, and they are totally satisfied with where they have used it for the preventive purpose. 70.1% of the subjects who responded to the gap-based study, they have expressed that Ayush methods gave an overall feeling of good health. Well, 63.4 responded that they are it is very useful in improving the sleep and quality of life scores, bowel habits, and all. And this is the same thing. Just this is indicated in the graph. And if you see these users out of the respondents, 46% subject used Ayurveda, followed by the homeopathy in 37% of the population, and followed by the Unani Siddha. But while yoga is, most of the people are using yoga along with these interventions. Gujarat people has responded more to the study, and followed by the Madhya Pradesh, Tamil Nadu, Andhra Pradesh, and Maharashtra. And this has given very good leads for us that the attitude of the health-seeking trends in the country, and also responses as a prophylaxis of I-64, R3 column, and other studies. This is the one study which is a in silico molecular docking study in collaboration with the National Institute of Nutrition. And I-64 has 4 ingredients of I-64 has been studied. And we have seen that 35 compounds exhibited good binding energies. While the most promising is one among them is academic N oxide from Saptaparna, which is Aristolia scholaris, which is one of the ingredients. It has shown much efficacy, which is under publication. These are the studies which are continuing. Just finally, to conclude, we can say that the interim trends of the prophylactic studies, they are well tolerated, no adverse effects clinically, and lab parameters. And on an average, Ashwagandha as a prophylactic care, we have 3 studies. We have seen that less incidence of COVID-19 in intervention group when compared to the controlled population. And second one, Guduchi, this is studied in 1.33 lakh population, 7 studies. This has shown that the onset of influenza-like illness was very minimal in the subjects we have consumed Guduchi, and this is having very good prophylactic potential. This is the interim trends of the Ayurveda studies as a therapeutic interventions. These are well tolerated, no adverse effects we have seen. And on an average, Guduchi studies have revealed that average recovery is 5 to 7 days, and most of the studies 4 to 6 days. And RT-PCR is becoming negative, while clinical recovery we have seen. Guduchi Pippali combination, the beauty, particularly the beauty of this study is that it is arresting the progress of the further progress into the respiratory complications. This is a good study, and reducing the days of the hospital stay. I-64 this is a compound formulation that an average recovery is 7 days, 7 to 8 days. Most of in 7th day, RT-PCR is becoming negative. More than 70% of the subjects from the trials, interim trends, shows that the clinical recovery is happening within 7 to 15 days. And this is well tolerated studies. And these are the brief interim trends based on that some of them have gone into the national clinical management protocol. This is a brief glimpses of the studies taken by CCRS. Thank you, sir. Thank you very much.
Thank you, Dr. Srikanth, for giving the brief presentation of various work which is done by the Council, and sticking to your time limit. Now, I would also request Dr. Christian Garbe to make his presentation. Dr. Garbe is the Managing Director of FIZ, that is the Frankfurt Innovation Center, the Frankfurt Biotechnology Innovation Center, corresponding to the philosophy of Dr. Garbe. FIZ develops customized concepts supporting a successful technology transfer and accelerating the implementation of innovation in the life science industry. So I invite you, Dr. Christian Garbe. I would also like to inform to the participants that the FIZ and the All India Institute, they have signed an MOU, and this MOU was reflected in the joint statement signed by both the countries, that is the India and Germany, during the visit of the German Chancellor last year to India. And they're working together. So Dr. Krishan Gabe.
Thank you very much. And it's a big honor for me to speak. I hope you can see. Everything is okay?
Yes, yes.
Yes. Okay, so we will start now. Yes, so Germany is following also the trend of Ayurveda, and for us it is an important step. And particularly last year when we signed this agreement with the All Indian Institute of Ayurveda, and it was together with the Chancellor of Germany, and it shows how important the collaboration with India, but in particular with Ayurveda is for Germany. And I will give you a short introduction into the Frankfurt Innovation Center. And so I will talk about our approach, and then the genomics approach, and the last chapter is about our projects regarding COVID-19, what we are doing, with whom we are working together, and what is the progress on these projects so far. Just a little bit about the Frankfurt Innovation Center. The Frankfurt Innovation Center was founded in 2002, and all of you, I'm sure, know the history of Frankfurt. It was once the pharmacy of the world, with Höchst, with the diabetes, with insulin manufacturing still today. And the approach of the Prime Minister of the state of Hessen was to set up the Frankfurt Innovation Center as a new hub for life sciences, to find the new ways for the future. And this is very important to understand. So it's not just done by the infrastructure, so the real estate infrastructure. No, it was very important to create an intellectual hub, so synergy projects, what we are looking at. So we started more or less 18 years back, but today we are now really going from the typical chemical industry to the biology, and definitely to Ayurveda. So as I said already, the stakeholder of the Frankfurt Innovation Center are the state of Hessen, the city of Frankfurt, and the Chamber of Commerce. From the beginning of the FITS, and this was very important to understand, we focused our technologies to service the emerging countries. So the new role of Germany, and particularly the role of the Frankfurt Innovation Center, was really to bridge this from the developed countries to the emerging countries, the technologies. And this is something that we started very early, and we started with a lot of international collaborations and joint venture. And the most recent one is that with the All Indian Institute of Ayurveda. What we did under this umbrella of our collaborations is to give consulting in the area of the technology centers. But what is more important is definitely to consult also the scientific community, the politicians, and also the business leaders about the future prospects of our technologies and services that we are doing. Here you can see a little bit about that, what's about the technology base that we have in Frankfurt. So we are working also in high security labs, working on viruses, different forms of good manufacturing practices that we have there. And for us, it was always important, as I said, this bridge to the emerging countries. It's about technology transfer. It's about know-how transfer. So we set up programs to educate people from abroad in Frankfurt to use the technologies that we have. And for example, it was very important during this COVID pandemic, and we developed PCR test kits that didn't use this cooling systems. So it was very important to bring these test kits also to countries in the emerging or to the emerging countries. And what was also important was the design and of our customized infrastructures, particularly for the lab users. So in the Frankfurt Innovation Center, we gathered around, we gathered a lot of companies, around 16 companies between 800 and 1,000 people are working in these companies on the areas of precision medicine, particularly now also in the area of artificial intelligence and healthcare. And this is just an example of companies that are working in these areas and that we are now really bringing together and for a clear focus on COVID. The companies in the Frankfurt Innovation Center are covering more or less the areas of the omics. So what we have is genomics, we have transcriptomics, metabolomics, and proteomics. And now we are bringing it together to the phenotype, so which means the diseases and the medication. And this is also something that is very important for us in our collaboration with the All Indian Institute of Ayurveda to have this background and to have the access to the patients. And so now, what was so important, and I listened to all the presentations this morning already, or this afternoon for you, and it was very interesting what you're doing there in India, and what we can join forces definitely in that. And you are the experts for all these Ayurvedic systems of medicine. And in Germany or in the Western world, we have really broad knowledge about the systems that we are applying. And I heard it already, if you talk about computational chemistry or something like this, all this is also in India, but we would really like to join these forces to bring this approach forward. So again, our aim is the symbiosis of ancient wisdoms and principles of Ayurveda with contemporary genomic medicines through correlating genomic variations with the classification of Prakti. And this is really something that is so important, as our approach always was to make medicine affordable and applicable in all the countries. And this means, particularly for Asia, that we have a new approach bringing both worlds together, and it's really for the benefit of mankind. And again, what was so important is really to understand that you're coming really from this evidence-based medicine. We are working in the labs, and bringing this together means really new ways of thinking and new ways of treatment. And particularly in the Western world, and we heard it already, the people are more and more keen of using these treatments as it is a more holistic approach. And so we try to work on this ground to bring it together. And here the next slide shows you how we are working in this manner. So we are talking to the government, the academia, the industry, and then also to the healthcare specialists, to the hospitals. And always our approach is the scientific research projects with a clear focus on diabetes, oncology, nephrology, cardiology, and the reproductive system. Particularly in the past, we worked a lot on cancer genomics, also with India together. And now we are focusing on the new approaches. Here, just some slides to show who we are and whom we could receive in the FITs. And we have been so honored to have the delegations from India in the Frankfurt Innovation Center, and also the signing of our MOU last year was really a big step forward, and we reached a lot of goals in that time. Also, the collaboration that we have with Art of Living is a very important milestone in our approach of bringing Ayurveda to the Western communities. And now I want to talk a little bit about our approach in COVID-19, what we are doing. So we recently applied for a grant from the Federal Ministry of Research and Science in Germany, together with the All Indian Institute of Ayurveda. And this could be really something very important for Germany, as we find more and more public funding for these approaches. And the objective of our study is to evaluate the preclinical effectiveness of Gudujari tablets in combating COVID-19 infection, and also developing valuable Ayurvedic-centric AI-empowered drug development workflows. So in the Frankfurt Innovation Center, we started very early working with AI tools. And so I think this is also the next step to better understand the mechanisms in Ayurveda. Understanding the molecular basis of the Ayurvedic formulation for supporting its entry to the clinical trials for COVID-19 pandemic, and also studying the genomic changes occurring in host by novel coronaviruses. So the research focus is for searching a globally accepted potential cure for COVID by generating this scientific evidence through mechanistic study, developing the Indo-German cooperation and mutual interaction, and performing cheminformatics studies, generating and analyzing multi-omics data from COVID patients under herbal treatment. And we started already this year studies together with Sri Sri Tattva. It's Sri Sri Tattva in Europe is the unit. And this studies was about the anti-inflammatory purposes or effects of the agents, and also what kind of effect was against SARS-CoV-2 virus. The first study findings that we have already is done by a company in France. So the Frankfurt Innovation Center has a broad collaboration network in Europe, and this company worked on the screening of the inhibitors of the SARS-CoV-2 spike protein, and the results so far are very encouraging. Particularly, so we analyzed different compounds or different plant-derived compounds, and all the compounds have shown an effect, and the most promising the Kabasura sample that has the strongest inhibition of the spike protein. That was the first results so far. We are going ahead together with Sri Sri Tattva in analyzing all these compounds and finding out how we can bring it forward. Something that is also in progress and very important for us, and it was already said in the first presentations, that very often the COVID-19 patients are suffering on mental illnesses. And I think that particularly in mental illnesses and mental health, Ayurveda can bring a major step or can bring us forward in this area. And so what we started together with also with the All Indian Institute of Ayurveda to work on this framework for a mental health study together with Innoplexus. It's a company based in close to Frankfurt, and they are working with artificial intelligence. The company was founded by an Indian and in Germany, and it's quite successful. A lot of public media is looking on that, what they are doing. And we want to bring this forward because it's not only just now focusing on the virus, it's also about what do we do with the patients after they are cured, and how can we bring them back to life in this sense. And there we can expect also a major step forward, bringing Ayurveda to Europe and also, let's say to the Western world, because it's a much better understanding and it shows the benefits of Ayurveda. So for me, it was really a big honor to present a little bit of that, what we are doing to you today. And I hope I was in the time frame. And so please feel free to contact us for further detailed information. And we are really open for collaboration because it's not just let's say European story or Asian story, it's a world story, and it's always international. Thank you very much.
Thank you very much, Dr. Garbe, for giving the outside of the various that research that you are doing and how the various opportunities are there. You are not only working with the All India Institute, but then you are also working with the other organizations like CC Tatva. And I'm sure that many other industries, they would like to be a partner with you. With this now, I would like to travel from Europe to Australia and to invite Dr. Dilip Ghosh for his presentation. Dr. Dilip Ghosh, he is the international fame speaker. He is from University, Western Sydney University. He is the speaker, facilitator, and author in nutraceutical. He has been involved in long time in drug development, both in synthetic as well as the natural and the functional food research and development, both in academic and industry domains. So I invite Dr. Ghosh for his presentation.
Good day, everyone. I'd like to wish you on this very auspicious day, the Dhanvantari, and Happy Diwali also. Particularly, I would like to thank Dr. Manoj Nesari for inviting me for this great platform. So today, I think before going to my discussion or talk, just one disclaimer. So I will show a couple of products or a couple of company names in my presentation, but I declare I have no financial connection with any of this company. So just showing two of my very recent books that published, one by CRC Press. That is the Natural Medicine, Clinical Efficacy, Safety, Quality. That was published last year. And this one just published last week by Academic Press, Nutraceuticals in Brain Health and Beyond. So I am showing, just to let you know, more than 40% chapters in these two books are somewhat coming from Ayurvedic domain. Today I will talk on some nutraceutical aspect. That's why I choose that term, the Ayurvedic. And I published this paper, the nutraceutical potential of Ayurvedic medicine, a few years back. It was highly appreciated and mostly by the industry people. And it was before COVID. And I will show you how the Ayurvedic has huge potential in combating COVID-19 pandemic or any other pandemic in the future also. This is one of the most viewed or shared structure of that virus, COVID-19 virus. We know it has three main proteins: the S protein, that is the spike protein. We have heard a lot about this. And this is one of my favorite picture. It is from one Australian institute, Doherty Institute. You can see so beautiful and so bright picture, but so dreadful. All these bright yellow dots, these are all COVID-19 virus. You all know, this is just few weeks back. I just want to show you these top 5: USA, India, Brazil, Russia, and Spain. If you see, India is very close to USA. But when you see the death rate, that death for 1 million population, that is lowest in the world, just 85. So you can see the USA and India, they are back neck to neck. Brazil, we are one of the world most fortunate country. In Australia, we have no local community transmission in last 10 days. It's a fantastic result. So the mystery of India's low coronavirus death rate, it is 1.5%. There are few assumption or hypotheses. Younger population, definitely. But we see in other countries also, there are huge younger population also affected. Let's start. It started 2.5 months later than the Western world. Strict lockdown, immediate strict lockdown, possible immunity, undercounting, and Indian, mostly the South Asian people, they have unique genotype. So these are not proved yet, but there are few. But to me, it is most probably due to the use of Ayurvedic medicine and our systems for last few centuries. So that is one of the most important point why Indian death rate is 1.5% only. Few publication in last few months. I will show you some of this. You have heard a lot about mechanism, how it works and everything. If you see, there are 4 basic target for therapeutic approach. One, we have heard a lot about SCE2 and S protein, the spike protein. Second one, the protease inhibitor. Also, few previous speaker also mentioned that blocks and prevent the TMPSS2. The third one is the virus-specific effector, CD8 T cells arising from the vaccination recognized infected cell. And the last one is the pro-inflammatory cytokine can be neutralized through the transfer of blocking antibodies. So these 4 are the basic main therapeutic approach. I am not going in detail because I have only 10 or maximum 12 minutes time. So hope from Ayurveda domain. So if you follow, I think the Indian people, they know in last few months. So there are huge boost of Ayurvedic products, not only in India, but in the globally. So I very thoroughly followed our Indian President, Mr. Modi ji's lecture also. He mentioned last couple of months, Indian export, Ayurvedic or spice export to the international market that grows 45%. That's a very staggering figure. And if you see the Chyawanprash sales across the industry grew 283% in June. Branded honey rose 39%. And Dabur Chyawanprash, I specifically mentioned because I got this information, that surged 700% from April to June. That shows it is not only the Indian, but the global interest in this area. There are many products, maybe not all Ayurvedic product, but we call the micronutrients or dietary supplement. It has some good clinical study backup, like zinc and zinc vitamin D3. You can see, you can read this one. And the good trial is undergoing in University Hospital Lille, France. Vitamin C, that is ascorbic acid. In Italy, ascorbic acid plus zinc gluconate, that is in Cleveland, Ohio. Resistant potato starch, it is in Yale University. Vitamin D in University of Granada, Spain. Copper, that is Oslo University, Norway. And fucoidan, that is a very unique fiber from seaweed, brown seaweed. It has shown tremendous effect in immunomodulatory and inhibition of viral entry, and that is under clinical trial in Bristol, UK. So there are very century-old, we called ancient immune supporting herbs, mostly from Ayurvedic domain. Garlic, the common kitchen ingredients. Ginseng, the root of longevity. Andrographics, Indian echinacea, and the very Indian love this one, the decoction, the kada. You can see there are a lot of claims, but study, it is no study on so far on specifically on the COVID patient, but it has some other viral infection. You have heard about this, what is, I forgot his name, the CCRAS, that deputy DG, the Ashwagandha, Guduchi, Shataburi, Amlaki, and Yeshti Madhu, and especially the Ayurvedic R&D task force. They have done a lot of study, both prophylactic and therapeutic study with Ashwagandha, Mulethi, Yeshti Madhu, Guduchi, Giloy, and Ayush 64 that was originally developed for the anti-malarial drug. But next few slides, I will give you some idea outside this Ayush target area. We know some few speaker already mentioned the viral entry is most important step. This is the first step. The virus enter into our cell. That means if we can stop that entry, so if we can stop that binding, so we can control the viral infection or viral load. And what is that? We know there is a spike protein, S protein, and there is a ACE2 membrane-bound receptor in all our membrane. It is mostly present in our respiratory system, but these membrane also present in other organ also. So if we can stop this one, so you can see less SARS-CoV-2 internalization. So that means we can reduce the viral load. So this is one of the most targeted therapeutic approach in today's world. I can show you one of my associate company based in India, but they are present globally also. They have some cinnamon-derived procyanidin A-rich compound. This is a very, very standardized special fraction of cinnamon. It is called IND02. They have done huge studies. I can show you some of the result. You can read. They have done in silico binding study. They have done that glycan binding nature with the spike protein, and they have done many studies, that mechanistic in vitro studies also. And that product has been selected by the CSIRO and Doherty Institute, that is the Australian government initiative. They have a new drug target against COVID-19, and based on this initial result, they selected that compound as a future drug target. So you can see it's already published in paper. It's a very, very high impact journal. And the last one we sent to the Nature Medicine also. You can see this cinnamon IND2, they have glycan masking effect and also blocking the RBD AC2 interaction. So that means they stop the viral attachment. So based on this result, they already published 4 papers in this area, and they have done all study in Taiwan, in China, in Germany. They are going to start, this one already started, the multi-center clinical trial. The first one is the prophylactic trial, phase 1, phase 2 combined with nasal spray. So that nasal spray already in the market, in global market. So it was approved by Australian TGA, it was approved by Health Canada, and it was approved by a couple of other regulatory bodies also. So, but it was positioned in the allergic rhinitis, hay fever area, but now going to do the 60 days study, the prophylactic trials. And the other trial that hasn't started yet, they submitted the ethics approval. That is a capsule of same cinnamon extract for 15 days with higher dose. As you see, one speaker, they mentioned the Sun Pharma. They initiate the phase 2 clinical trial on AQCH. So AQCH originally developed for the dengue disease. Now they reposition this, and this is the first phytopharmaceutical drug as approved in India. So I know you know what is phytopharmaceutical. I don't want to explain this. The first phytopharmaceutical drug clinical trial to be conducted across 12 centers in India on 210 patients. I think this started in October. This is the polyherbal. You had an activity in vitro and they are also targeting both prophylactic and therapeutic strategies, and they are also ACE2 receptor, and they are planning to run a big randomized trials. There are a lot of clinical trials that is undergoing in India. This is from the personal communication from Dr. Lal Hingorani. A small observation on clinical trial with Kalmeg and Guduchi. They showed the significant improvement in fever, pain, cough, body pain, runny nose, and overall recovery is faster and hospital stay reduced. Things that is outside Ayush current task force. So Ayush trial already discussed in detail. So take home message, I think most of the data are coming from the treatment studies and not many from the prophylaxis study, but the prophylaxis very, very important, particularly for the young children who might have very high level of their nose, but they have very minor symptoms. So if we only depend on the viral dose, that means they can neglect the other symptoms also. So just a few words about our center. So that National Institute of Complementary Medicine, that is in Western Sydney University. This is world largest clinical trial center in complementary medicine outside China. We have a dedicated big center. We have 75 people, permanent people working there. We have 4 big clinical trial platform. That is one in brain health, another in women's health, another in cardiometabolic area, and the last one in life after cancer. So we have completed more than 100 clinical trials in last 12, 13 years. In this 4 area, we have done outside area. We have signed a few MOUs with Indian partners. We have done All India Institute of Ayurveda, Ministry of Ayush. We have done clinical MOUs with Pune University, and we are working to develop a Ayurvedic chair in Australia also. Thank you very much.
So thank you, Dr. Dilip Ghosh. And now I would like to invite Professor Nina Claudia. Professor Nina Claudia is the professor at the Faculty of Pharmacy at UFRJ. That is the university with the specialization in the phytotherapy. In addition to teaching at the graduate and postgraduate level, she also coordinates the laboratory and applied botany, developing the research and extension of projects aimed at health promotion, integrative and complementary practices in the unified health system, ethnobotany, and popular knowledge and studies in ultra dilution in plant models. So I invite Dr. Nina for your presentation. Dr. Nina is from Brazil.
Thank you, Dr. Mazari. Good morning, everybody. Good morning. Brazil is so early in the morning.
Yeah.
It's a pleasure to be here. I will try to share my screen, my presentation. Let me see. I believe you can see it. Yeah.
Yes, we can see that.
Okay. So it's a pleasure to be here. I would like to thanks again to Dr. Nazari for the invitation. And I will present some aspects of research of Ayurveda in Brazil. In Brazil, Ayurveda is covered by the national policy of on integrative and complementary practices, which provides for offering of Ayurveda in the unified health system and encourage research in the area. Although the policy was implemented in 2006, Ayurveda was only included in 2017, along with other integrative practices, as you can see on the screen. So currently, in the Director of Research Groups at the Brazilian National Council for Scientific and Technological Development, the CNPq, the main Brazilian institution for promotion scientific research. We have nowadays just 4 research groups involving Ayurveda in scientific research. These groups are led by professors from federal public universities, distributed in 3 different Brazilian regions. One in the southeast is the university that I teach, that I work, is the Federal University of Rio de Janeiro. One in the Midwest is the Federal University of Brasilia, and 2 in the Northeast, 2 other federal universities. Also according to the data found in the CNPq database, currently 88 researchers are have their CV registered as developing sometimes of academic work in Ayurveda in the last 10 years. So we can say that it's necessary to increase the number of research in the area and promote a greater interaction between groups that are already working on research with Ayurveda. I believe this network can be stimulated and supported by the Brazilian Academic Consortium for Integrative Health, known as CABSIN. CABSIN is a collaborative network of researchers, universities, and research institutions for all over Brazil in the area of traditional, complementary, and integrative medicine. And your mission is to contribute for the scientific validation of integrative and complementary approaches in health through the systematization and production of studies and research, increasing the visibility of scientific knowledge in the area and promoting exchange and collaborations between researchers, universities, and national and international research groups. It's part of the mission to support the implementation of the traditional medicine in an integrated manner in the public health system. The consortium already currently has 4 thematic groups, and more recently, we created a new committee, the Ayurveda committee, that is coordinated by me. And in the Ayurveda committee, we have the first product produced by us in the CABSIN. We have prepared a consolidate of the protocols and guidelines developed by the Ministry of Ayush to face the COVID-19 pandemic. This digital material, this is the first time we are showing this material. This digital material produced in form of an ebook had the participation of a group of experts in Ayurveda and yoga in Brazil and Argentina. Forming a network of collaborators, it had the support of the India embassy in Brazil and Argentina, Uruguay, and Paraguay. In addition to the translation into Portuguese and Spanish of the original documents, these are the documents that we worked in. These 4 documents produced by the Ayush Minister, the Minister of Ayush, sorry. So in addition to the translation into Portuguese and Spanish of these original documents, appendices were elaborated to aim in the best application of Ayurveda locally. So as you can see in this table, it presents, it indicates if a plant seated in the test can be found in Brazil or Argentina, and where, in which way they can be found. If the plant grows naturally in the habit, and then your natural habits, or it can be assessed just by the commercial way. I'll also include some photos of the most common plants in Brazil that found in India also, and we present the plants that already is also found just in India, only in India. So, still related to COVID-19, I'm a team of researchers formed by me and Dr. Carlo Landino, Dr. Ricardo Gelman, coordinated by Dr. Mariana Cabral from Unifesp, the Federal University of São Paulo. Submitted a clinical trial research project with the traditional formulation of Ayurveda based on Tinospora cordifolia, the Ayush 64. The main goal of this project is a multi-centric project involving the participation of the All India Institute for Ayurveda and the University of KwaZulu-Natal in South Africa. So, the main goal of this project is to evaluate the effectiveness of Guduchiada tablets and combinations in case of mild to moderate COVID-19 newly diagnosed in patients over 50 years age and with comorbidities. We are waiting the result of the request for financial support to CNPq and waiting for the ethical approval. And it will be executed in the city of Partido Ferres. It's a city in the near of Rio de Janeiro. In the same location, Partido Ferres, another project research is underway as part of the master research project from Bárbara Neves. And the main goal, this project will evaluate the improvement in the quality of life of family health strategy professionals, health workers in Partido Ferres, based on the introduction of daily practice in Ayurveda. The main goal of this project is to evaluate the role of Ayurveda practice in improving the quality of life of professionals in the family health strategy program from the unified health system in Brazil. This project will promote theoretical and practical training in Ayurveda-based pillars, food, sleep, meditation, and physical activity, so that these professionals can apply Ayurveda in their own lives, and after to receive the training, they can act as multiplying agents to promote Ayurveda as an integrative practice for the citizens of Partido Ferres. It will be based on application of a whole brief questionnaire, and as a product, we intend to develop a guide for the introduction of Ayurveda practices by patients of the local public health care. So, to conclude, an important step toward the advancement of Ayurveda research in Brazil is to establish a larger network of researchers on the subject. And for this, it is important to seek and identify new partners, nationally and internationally, in order to contribute to spread and consolidate Ayurveda in Brazil. So thank you very much for your attention. Feel free for call me, for contact me if I have any questions. Thank you very much again. It's an honor to be here.
Thank you, Dr. Nina, for giving this your presentation and informing about the various initiatives that you have taken. And we also appreciate and congratulate you for translating the guidelines into the Spanish and Portuguese language, and I'm sure that it will be very useful for the people in your country. And we look forward for more and more collaboration, and we can work together. So thank you very much. And now I would like to invite Dr. Aslam. Dr. Muhammad Aslam, are you there? Dr. Aslam from Department of Biotechnology, are you there? I see your name. Probably seems that Dr. Aslam is busy in some other engagements because I see his name. Now there are two presentations from the NIA Jaipur and
Joining.
sorry. Yeah, Dr. Sunidhi.
Dr. Aslam is there, sir. He is joining.
Yeah. Okay.
Yeah. We joined.
I see his name, but I couldn't see him.
Yeah, I just spoke to him. He is joining, sir.
Okay.
Dr. Aslam, are you able to connect?
He's connected. I see him. Somebody has already logged on behalf of him.
Yeah, his name is there in the list.
I think there is some problem. Let us move on to the next presentation. Now I invite Dr. Pawan Kumar Godatwar from the National Institute of Ayurveda Jaipur for making the presentation regarding the work done by the NIA Jaipur. I request you, Pawan, to be as short as possible because we have already overshooted by 1 hour.
Okay, sir. Thanks a lot, sir, for inviting me and giving us the chance to present whatever brief work we have done in this COVID. So, sir, I would request you to allow me to share the content.
Yes, yes.
The screen very quickly. My namaskars to all the elders present here. Sir, the title I will be presenting is Experience on COVID-19 Research, the NIA perspective. So, bird's eye view of the flow of the study will be, I see what we have done in this past few months is after long study, sir, ICMR NABL accredited COVID testing laboratory has been set up in NIA. 4 clinical trials we have completed. 2 clinical trials with Ghana WHO are in pipeline. And we have recently started a post-COVID rehabilitation center. Sir, this is some photographs of the ICMR NABL accredited RT-PCR lab. First study which we have done is the prophylactic study, sir. open label, multicentric, randomized, comparative, prospective, interventional, community-based clinical study to evaluate safety and efficacy of Guduchi Ganavati as a preventive remedy. We did this study in 6 containment areas of Rajasthan, that is Jaipur A, Jaipur B, and NIA, Ajmer, Kota, Jodhpur, and Tonk. So in these 7 areas, we have done this study. We had planned 1,000 patients in each, 1,000 participants, but due to different mitigating circumstances, we could complete only 10,200 completers. Data of 5,200 is being presented here. The other data is being analyzed right now. Sir, the mean age in Group A, that is the Guduchi Ganavati group, was 38 years, and in Group B is 37 years. So there was not much difference in the groups. Males and female, there was no difference in group as a distribution. Incidence of COVID-19 infection, total number of positive subjects, 20 in Group A, that is treatment group, and 28 in Group B, and negative subjects 41 and 44 for the total number of tests done of COVID-19. So the chi-square test was applied, sir. Two-sided p-value was 0.34, which is not significant, but the difference is directly observable. After 10,000, we will be able to see more pronounced differences, sir. Table number 4, number of subjects requiring hospitalization or home quarantine. Again, there is a significant difference. Not statistically significant, but clinically it is reasonably important difference. A lower number of subjects required hospitalization in Guduchi Ganavati treatment group A as compared to control group. Number of subjects with incidence of infections related conditions. Again, statistically there were not difference, but the statistically significant low number of subjects had incidence of infection related illness in Guduchi Ganavati. Maybe, sir, this prevents the illnesses and respiratory infections. Assessment of individual symptoms of infection related conditions. Again, low number of subjects were reported to have incidences like fever, cough, cold, sore throat, and other infection related symptoms in Guduchi Ganavati treatment group as compared to control group. The manuscript is being readied, and we have already sent the first draft to the mentor of DSMB and PMU, that is Project Management Unit set up by Ayush. Major outcome from interim analysis, average age of the subject participating in the study is around 37-38 years. Lower number of subjects were infected with COVID-19 in Group A, that is the treatment group. Lower number of subjects required hospitalization as compared to those who were home quarantined in Group A, that is treatment group. A statistically significantly lower number of subjects were reported to have illnesses related to infection in Guduchi Ganavati treated group, and lower number of subjects complained of symptoms or conditions like fever, cough, etc. in Guduchi treated group. Another study was Dabar Chyawanprash study. This was also a multi-centric study. One of the center was NIA. 180 subjects were recruited in NIA. Milk group 87 and Dabar Chyawanprash group 86. Skin failure rate 7 and we randomized 173. It also showed a good preventive effect in overall scenario. Quickly coming to the third study, which is a very important study. It was in collaboration with All India Institute of Medical Sciences, Jodhpur. Sample size was 60-30 in each group. Evaluation of efficacy and safety of Ayurveda intervention, that is Ayush 64, as an add-on therapy for patients with COVID-19. This study has been just recently completed. These are the baseline characteristics which don't differ much statistically. The RT-PCR result, which are the most important and interesting results, that RT-PCR positive cases were less in the intervention on day 5, that is the recovery date on day 5, as compared to control arm, is very significant. Statistically, it was not significant because the number of patients were very small, but the difference is visible. And even they are searching for other statistical tools to analyze the data. This is directly from AIMS Jodhpur. They said that this is very interesting result, and they have given an interview in the television also on this aspect of the study, that the turnaround time is impressive from when Guduchi Ganvati is Ayush 64 is added to the standard treatment. We did, sir, some Ayurvedic uh, analysis also, Ayurvedic testing also. The outcome measures were in terms of Ayurvedic clinical terminology. That might be interesting to you. Therefore, I mentioned this in the passing. There was no significant difference in the secondary endpoints. None of the cases reported any ADRs. No patient was referred. No patient required invasive or non-invasive intervention, and none of them developed multi-organ failure. These were cited as success of this short study. Third study we did was cross-sectional retrospective study on immunobooster kit, that is Chyawanprash, immunity booster capsules, and Quath prophylaxis for the prevention of COVID-19. This is an interesting study that we started as soon as this COVID hit India. Primary data we started collecting from 24th April 2020. And the data is from 24th April to 27th June. We distributed 4,660 these Ayur booster kits, immune booster kits prepared specially in NIA and to the high risk group people. 1,003 documents were considered and analyzed because we couldn't design this study properly at that time because we were busy in catering to the actual needs of the people. But then we realized that we could have made a retrospective study. So we again contacted them, and this 1,000 people responded back. This is the summary. None of the participants had developed any symptoms for COVID-19 after taking the medicine for about a month. So that is an interesting and impressive story. And we have been flooded with requests from the police headquarters and all such high risk group people to keep on providing this immune booster kit. I'm not going into the details of this distributions and all that. They're interesting. Very quickly, a photographic show of post-COVID rehabilitation center, which we have started just now. So again, thanking you a lot, sir, for giving us the time and opportunity. Thanks a lot, sir.
Thank you, Pawan, very much for absolutely keeping in time. And the last presentation now we have from Jamnagar, and I would like to invite Dr. Mandeep Goel from Jamnagar, and after that, immediately we will have the panel discussion. So Mandeep, try to be as short as possible because some of the panelists, they also have to go for some other programs. Dr. Mandeep Goel is there from Jamnagar?
Sir. And are it?
Okay.
Yes, sir. So, which carried out in IPGT and RA.
Okay.
Yeah. Sharing the screen now. Is it visible, sir?
No.
Just. Sir, here there is one notation that we could not display your shared content. Make sure that you are allowed permission to share content. So whether there is some technical thing that you might have to give me permission to share the content.
Mr. Nishant, can you help please? He requires permission for sharing the content.
Suniti, what I would suggest that till actually the problem is resolved, we will start with the panel discussion, and at the end, again, I can come to Dr. Kalpesh for his presentation. So immediately we will switch over to the panel discussion. I hope you would agree, Dr. Kalpesh?
Yes, sir. This is Dr. Sagar. It's absolutely okay, sir.
Okay. So now I would invite we have the panelists from the across the world. We have Vaidya Devendra Triguna. Vaidya Devendra Triguna, he is the Padma Shri and Padma Bhushan from India. He is the Ayurvedic physician and the expert in the pulse diagnosis. He is also the honorary physician. He was the honorary physician to the President of India and the incumbent president of the Association of the Manufacturers of Ayurvedic Medicine and the All India Ayurvedic Congress. The Government of India, he is awarded with them highest civilian awards, Padma Shri, and after that, the Padma Bhushan. So I would like to ask two questions to Veggie in this context of the pandemic. Since you are the eminent Ayurvedic practitioner, so what is your opinion on the role and scope of the Ayurvedic practitioners in the management of COVID-19 infection? Because we have a large number of Ayurvedic practitioners, and as everybody has now said and demonstrated that Ayurveda is very effective in this. So how the Ayurvedic practitioners they can play a role in this COVID pandemic? This is first question. And the another question is that since you are having the vast experience at the international level also, how do you see the situation as an opportunity for Ayurveda for providing protection to the global community?
Yes, Jai Ayurveda, Jai Dhanvantri. Dr. Manoj Nesri ji, first of all, I should congratulate on this Dhanvantri Day and the National Ayurveda Day, as the Prime Minister has dedicated Jamnagar Institute and the Jaipur Institute to the nation. That's a big news for us, for India and all over the world. So now, from the COVID point of view, as we are practicing in our practice right from since March, we are giving for the COVID patients and now for the post-COVID patients. Ayurveda can treat both the things, not even for prevention, for also curative also. We have seen in the All India Institute of Ayurveda how it is doing well. But in our practice, we have seen that, as we have said, that we have to make the immunity strong of the person. In India, we have first given it like Ayush Path, the rasayanas, the prevention, the herbs like it's haldi or it's tulsi or madhuyasti. So these all things, all this either is Brahmrasayan or Chavanprash, these all things have given it an immunity boost not to India, all over the world. And now the post-COVID has started since 1 or 2 months, and lots of patients are coming after the post-COVID. And then the post-COVID, we have seen people are getting fatigue and tiredness, having a problem of chest breathlessness and some in the congestion in the chest, and too much weakness, and appetite is not very good. Then you feel all the day tired and the sleep is not good, and then some pressure on the nervous system. So these symptoms can be tackled with the Ayurvedic herbs and medicines. Like before, we have seen in chikungunya and dengue, those after effects of chikungunya and dengue were coming, even it stays for years and years. And like in this post-COVID also, if we treat it with the rasayanas, especially also with the gold medicines, gold preparations like it's Swarnprasan Malpi or Krishin Chaturmo grass, or we can give Samir Panna grass, and then other rasayanas, herbal rasayanas like Ashwagandha, Shatava, Chavanprash, Brahm rasayan, and then according to the symptoms, we can add our medicine. So these things will be given a good relief to the patients, and the chronic symptoms which are there for a long time, this will be also, the patient will be happy, patient will get relieved. So our department, Ministry of Ayush, should make a protocol even after the post-COVID, that what should be the given. And I will request our secretary, Ved Rajesh Kotecha, he is a dynamic secretary, and the Vedya also, and Manoj Nesri ji, who is handling this, that after the post-COVID, you should consult some physicians who are treating the this post-COVID patients, and what should be the given and what should be the protocol from the Ayurveda point of view. And this is the main thing. And then the diet should be there. What you should take little lukewarm water and put haldi in the milk. That's very good. And now that as the winters have started in India and all over the world, you should take prevention from the cold wind and don't take cold water and hot. Don't take very cold things. If you have a little like cough and mucus, don't take yogurt. So these things prevention should be taken. But from the uh, post-COVID point of view and the COVID point of view, this line of action should be given. And from the world point of view, India should give a also protocol to the all over the world, that which are the number 1, 2, 3 herbs or the herbal minerals which is good for the persons to be given, and what is the protocol, so that the peoples in other part should also have better quality of life even after the COVID. And you should have also one research that you are going to plan with the South Africa and the Brazil and India. That result will also will come. But as the WHO DG has announced today, that there will be a one center in India of the this Ayush traditional medicine. So that is a big news for India, big news for Ayush department, that this center will be opened in India, and we will have much better coordination with the WHO and all over the world. So I once again I congratulate Ministry of Ayush on Dharmantri Day, especially to our Minister Shirpad Nayak ji, our Secretary Ved Rajesh Kotecha ji, Manoj Nesli ji, and the Prime Minister, that gift has given to us. So I have no words for the Prime Minister to thank. So with these words, I can say that in our clinic, in our patients, we are treating it with the COVID patients also for the prevention and curative, and also for the post-COVID. The results are very good, and Ayurveda will not to India also, but to whole of the world. It will give a good help to that. Thank you, Jai Ayurveda.
Thank you, Vajji, for your this elaborate answer, as well as for sparing the time since morning for this webinar. And now I would like to ask you, Mr. Mark Rosenberg. Mr. Mark Rosenberg is the founder and managing director of the European Academy of Ayurveda in Germany. The branches of the academy have also been spread to other European countries like Austria and Switzerland. He puts great effort in research and holistic practice of Ayurveda and yoga. Mark Rosenberg is the president of VEAT, that is the European Professional Association for Ayurvedic Practitioners and Therapists, and program coordinator of the Indra Network. So I invite Dr. Mark Rosenberg, Mr. Mark Rosenberg, and the specific questions that I have for you, it is that you have been conducting the academic programs based on Ayurveda in Germany, and apart from that, you also have been providing practical training in Ayurveda therapies. How has the current pandemic affected the teaching and training, and and what the measures you have taken to deal with this problem, and how effective this was? So this is my first question. And the second one is that in the joint statement of this strategic partnership of sustainable growth and reliable international order between India and Germany, Ayurveda have been heavily featured as one of the prominent areas. Now, in this, how do you see the opportunity to further improve this collaboration between Germany and India?
Right. I hope you can hear me.
Yes, yes.
Good. Thanks very much for inviting me. Thanks to Minister Shripad Naik and to Rajesh Kotecha. Thank you very much, Manoj Nezari, for this opportunity to share a bit our experience here in Germany and the German-speaking countries. So as you know, I'm supporting Ayurveda for 30 years now, and I believe that education is one of the key tasks to spread the potential of Ayurveda globally. And yes, as one of the largest schools in Europe, we have trained thousands of students, and among those, there are around 1,200 medical professionals, means doctors and practitioners of holistic health. Those are now treating patients through the classical methods of Ayurveda, and through that, Ayurveda is really also spreading here in Germany. And now the pandemic has come, and of course it has affected the free run of our classroom trainings. And what could we do? We thought that it is important to switch to the online programs, as many other schools have done. But additionally, there was 2 years back, we started to design a web-based training in Ayurveda as a complement to our classroom teachings, so that students can easily gain knowledge about the Shastras wherever they are and whenever they have time for their learning. So, actually, this is a new form of teaching, and it includes ebook readings, it includes quizzes and memories, interviews, videos, podcasts. It also, has a link to a huge knowledge database. And of course, at the end, there are online checkups and learning checks, and at the end also an exam, which is designed by an online mechanism. And we were happy that we were able to release this new form of learning right when COVID pandemic started. And in the last half year, there were more than 250 new students. Those have signed up for these programs because it was there and it was at the right time to promote Ayurveda through these new mechanisms of didactics and learning tools. Really, it is fascinating that within the corona pandemic, many students, those a year back, had told us no, they would never use online trainings. They want to have classical classroom trainings. No, they would, stay away from the internet learning tools because they feel it is much more important to work together with a teacher personally. And these mostly elderly people, they had now to switch to the online program, and the feedback is so positive. We hear from exactly those same persons that, wow, it's working great, and now it's a great chance. And we see that learning is also possible through these modern ways. And it's encouraging to see that because of the pandemic, things had to move forward, and it has many positive elements we see and we experience. And it's great that also Ayurveda is now part of it. That not only on the university levels, students are, part of webinars, but now we are a step even further with the web-based trainings, which are, which give the opportunity that students can learn Ayurveda whenever they want and wherever they want. So this is interesting, and we're very much excited about it. Now, the other thing that you have discussed or that you have asked for is about the contract between India, where it was agreed that Ayurveda research, yoga and Ayurveda research, as well as education, has to be discussed and has to be promoted and has to be moved forward. And you ask, what will be the impact of that agreement? And I would say that, first of all, it's a wonderful agreement, and it will definitely enable us to get more governmental support here in Germany to recognize Ayurveda in our healthcare system. I'm really glad that our Chancellor Merkel is open-minded for the traditional Indian healthcare knowledge and the experience, and to discuss partnership in research of yoga and Ayurveda, and for integrating Ayurveda in our modern healthcare system for a healthier and happier life. Germany is ready to open for incorporating a traditional system that has shown its efficacy, and it was proved for more than thousands of years now. I mean, let us underline that doctors have generally freedom here in Germany to use complementary and traditional therapy if a doctor feels that it is good for his patient. And this is a great advantage here in Germany. I think that Germany is maybe one of the few countries in Europe where that freedom is there for a medical professional. Secondly, in Germany, the population is really pro-natural and traditional medicine. And we also have to keep in mind that the therapists can open an Ayurvedic center along. The therapies are not medical. So in the moment somebody wants to give massages and give nutrition counseling, it's very easy to open up a center and to give these kind of services. Of course, it is not quality control, but therefore there is the different associations and different initiatives so that quality is assured here in Germany. What I want to underline is that I think that Germany, yes, is a good country to move on, and where this contract now between both of the countries will help us to bring Ayurveda forward to a great extent. So let me thank you all for listening to our experiences here in Germany, but also in Austria and in Switzerland. As you know, that we are also the largest training school in Switzerland. And we see that there are great examples in Switzerland how also in the field of education and linked to the governmental institutions, Ayurveda can be implemented step by step. And I really wish to thank you personally and to the whole team who are so much behind to have that collaboration with Germany. Thanks a lot for that.
Thank you very much, Mark, for sharing your experiences. And I'm sure that this must be learning to you also, and from your experience and your experience, the others, they will also learn, and there will be more this online training and other things, they will be there. At the same time, all of us now, we know that since there is this partnership between the Germany and the India at the federal level, so definitely this will open more doors, not only to the Germany, but in other countries as well. So now I would like to invite, thank you very much. And we have one doctor who is from Mauritius, Dr. Purnananda Rai Juravan. Dr. Purnananda Rai Juravan is from Mauritius, Africa, and he is the officer of the Order of Star and Key of Indian Ocean. He is the postgraduate from Jamnagar, having 20 years of experience in the field of Ayurveda and Ayurveda advocacy. So, Dr. Juravan, I would like to know how the Africa and the Mauritius, so they have been dealing with Mauritius, and as an Ayurvedic physician, what are your experiences in providing services of Ayurveda, and how do you see the prospects for Ayurveda in future?
Namaskar, sir. Am I audible?
Yes, sir, you are audible, but we can't see you. Just switch on your camera. You were visible in the morning.
Yeah. Here it is.
Okay, doesn't matter. Please continue. We can hear you.
First of all, Jai Dhanvantari, Jai Ayurveda. Many best wishes from Mauritius to all the Ministry of Ayush and all the brothers and sisters of Ayurveda lovers and Ayush lovers throughout the globe. It is a matter of pride that we are celebrating the Ayurveda Day. You would remember, sir, in 2016, the idea of Ayurveda Day was discussed in a conference where you yourself and the Minister of Ayush, Sri Yeshwar Nayak ji, was present. So it gives immense pleasure that we see that now it is coming to a World Ayurveda Day because the globe is observing this day. Mauritius is one of the rare countries outside India where Ayurveda is recognized. The practice of Ayurveda, it is legalized. We have got a law, the Ayurveda and Other Traditional Medicine Act of 1989. So Ayurveda, it is practiced and recognized lawfully, legally since several decades in Mauritius. Now, apart from the legal aspect, the government of Mauritius has mainstreamed Ayurveda. That is, in our Ministry of Health and Wellness, we have got an Ayurveda unit. And at present, we're having 6 Ayurveda clinics running throughout the island. The population is 1.2 million. We are a small island in Indian Ocean next to Madagascar. And so you'll be happy to note that we are again one of the rare countries in the world where we have been COVID-free for the last 6 months up till yesterday, where we got a few cases in the community. Since the onset of the pandemic, we mobilized the Ayurveda unit of the Ministry of Health. We thought that as we have studied, just as in the morning you said about Janpadodvans, so we have to make use, just as in Charak it is, the chapter is there, we have to unite, you start assembling, start gathering all the medicines for us to face the pandemic. So that we have done, we had made a plan. Our plan was most prevention, prevention, prevention. Because we know that in such a situation where it is an obsargic rog, there is a verse of Susrut which says, Sansargat gat sansparshanat, niswasat sahasaya asan bhojanat, vastramalya anulepanat, obsargic roga sankramanti narat naram. So it is a way of transmission. So we started coming into the national television and intervening of how Ayurveda and how our Dinacharya can be beneficial to the people in preventing these aspects, these pandemic. And at the same time, daily in peak hours, we had intervention not only from the ministry side, but even our association, the Association of Ayurvedic Practitioners of Mauritius. We intervene into the national peak program, talking about the different herbs and spices which can be made use of in this pandemic time. Herbs were available and plants that we are already getting from India. We started giving to our patients who are attending the OPDs, and we gave a longer period of time, the medicine for a longer period of time. Then we really readily realized that in the long run, we'll be in shortage of the drugs. We readily wrote through our ministry to the High Com of India in Port Louis and through the High Com to the Ayush ministries, the government of India, requesting for some medicines which we, the list of which we sent. And sir, it is an opportunity today to thank the government of India, especially the Ministry of Ayush, because readily we received several tons of medicine which were shipped from India to Mauritius. And all these medicines were used for the people, for the community, free of charge. Actually, the service in the Ministry of Health, it is completely free of charge. Even Chyawanprash is all the drugs that we give, they are all free of charge. So, sir, in that way, we have been able to help the people to boost their immunity. Drugs such as Amla, Guduchi, and all the details which have been discussed in the morning, all these we have been making use of. Yeah, we were not having Chamshamani Vati, but we got the stock from the Ayush Ministry, and that we again started distributing. So in this way, Mauritius was able to contain the pandemic for a quite long period of time because the government of Mauritius was very, very strongly taking actions. We had complete lockdown for a long period of time, and ours was more on prevention, isolation, treatment, and tracing. In the prevention, we were very actively participating because self-hygiene, dinacharya, all these things, nasya, gandush, all the protocols of Ayush were again in our local language, daily talked and through the different media that we have. Then in the isolation, we had the ministry had set, we have got several hotels in the coastal areas. So there, they were kept, the people were having signs and symptoms of COVID, they were isolated. To those people and even to our frontliners, we gave simple medicines which were going to boost their immunities, amla, chyawanprash, etc. So there again, we intervene. In the treatment side, it was a protocol only based on modern medicine. And in the tracing, the government of Mauritius, they had developed, the Ministry of Health had a very strong unit going to trace people house to house and doing their test because the contact tracing was very important. And there was also communication with the people of Mauritius. Daily, there was intervention by the ministry to the people, what is happening, how they are dealing, what is the status, what are the prevention measures are to be taken. The community also, they played a very important role because they understood and they followed the guidelines set by the ministry. So in that way, sir, here in Mauritius, we were very, very, what to say, we had the opportunity to stay COVID-free for a long period of time. In Mauritius, sir, we have got a very strong team of youngsters, most from Jamnagar, doing undergraduation from Jamnagar and post-graduation from Jamnagar, and even from BHU. We have got nearly some 15 Ayush practitioners, of whom 8 are working with the ministry.
Yes, thank you, Dr. Joravan. So
Yes, sir.
you explained very nicely that how actually the situation you have controlled and you have prevented this spread of COVID in the Mauritius. And now I would like to go to Dr. Amit Bhargav. Dr. Amit Bhargav, thank you very much. Dr. Amit Bhargav is the council member and the medical director of the Ayush collaboration projects of the College of Medicine. Dr. Amit is a GP senior partner at Southgate Medical Camp in Crawley and member of the council of the College of Medicine from UK. Dr. Bhargav, integrated medical model has been successfully operating in UK. An MOU between the All India Institute of Ayurveda and the College of Medicine has also been signed, which will enable, among the others, the development of evidence-based guidelines for integrating Ayurvedic principles and practices with the modern medicine. The NHS has begun consultation to prepare the roadmap to incorporate traditional wellness systems like Ayurveda and Yoga to complement modern medicine. This is actually what we heard. So we would like to know in this context that how the UK's National Health Services dealt with the COVID pandemic. So this is my first question. And the second thing we would like to know from you that how do you see the scope of integrating Ayurveda in the National Health Service of for the purpose of prevention, management, and the post-COVID rehabilitation.
Thank you. Thank you, Dr. Nassari. It's been an honor and a pleasure to be with you, and especially to listen to our senior politicians and the Prime Minister talk about Ayurveda and our scientists talk about what's being done. It seems like I'm in the company of like-minded seekers, all of us seeking to find a way to improve the health and wellness of our populations, especially using Indian traditional medicine and Ayurveda as a form of getting there. And we know wisdom traditions, and there are many, including Chinese, Egyptian, and Greek, have all been trying to get to this place. And I think Indian traditional medicine has a special place. So what we found, and just to give you some idea about the COVID in the UK, we are in lockdown. We had over 33,000 new cases yesterday, 573 deaths, more than 50,000 people have died already, and lots of hospitals are not functioning well because of overload and the politics in the UK and across Western Europe, America have been affected by COVID. So what it's actually shown very clearly is that traditional or standard Western medicine, which is based on cure and single disease models, does not function very well for pandemics, whether it is a COVID pandemic or it's a pandemic of lifestyle diseases or opioid crisis, or the fact that we may have superbugs for antibiotics, and we need a different form that will fill that gap of health and wellness, where we improve the resilience of the humanity. So as the Prime Minister said, if you're well, you remain well, and if you get sick, you get better quicker, right? So that is the holy grail we are all going to trying to get to, and Ayurveda is a major step forward to that. So I'll come to what we're doing in a minute, but let me just tell you about College of Medicine, because what we've been trying to do, and we had our 10th birthday party yesterday as a College of Medicine and Integrated Health, is doing everything that Ayurveda has been promoting in all but name. So we are about service, science, and healing, and that has been our motto, that we bring the science and healing together. And you can see the words that are very similar. And of course, Ayurveda is about life science and life balance, and so is the college. So we've been together. So, and our college patron is HRH Prince Charles, and he's been in the forefront of the ecological movement for many years, and a huge supporter of complementary medicine and social prescribing, which is how do you take the complementary medicines to the community. So he's also co-authored a book called Harmony, which is, of course, inner and outer harmony, which sustains us and the people around us. So he's been our patron and has been promoting this and working very closely with Prime Minister Modi to bring Indian traditional medicine to the UK. So the kinds of things the College of Medicine has been doing is we have a foundation course for integrated care and a diploma which brings complementary medicine, including yoga and herbal medicines and other forms of complementary medicine, acupuncture, to be taught to standard Western medicine doctors and clinicians. So what we're doing is for the last 10 years promoting that form of thinking. So when we talk about Ayurveda, our clinicians are ready for that dialogue and integration. So we've also done food. We've done 3 conferences: food as medicine, food as a forgotten medicine, and food on prescription, which looks at the principles of Ayurveda on a plant-based diet, that seasonal eating fresh food, eating food that is grown in an organic way, which we call providence. in this country, so which are being ethically grown, so that we're promoting those, and that is very much in line with Ayurvedic principles. The yoga, of course, harmony in health, we've been promoting. So when you ask me the question, how does Ayurveda fit into COVID? And what we've also noticed is COVID, that a lot of people have started doing yoga online. It's very, very popular. And there are so many classes on Ayurvedic food. There are many classes on plant-based diets, and living the Nacharya type of people who have regulatory lives. So the NHS, having been pummeled by COVID, the population is ready for Ayurveda and the Ayurvedic principles. So what are we doing now? You mentioned that we have a memorandum of agreement, and in April 2018, Prince Charles and Prime Minister Modi unveiled a plaque to create a center of excellence in Indian traditional medicine in the UK. And one of the first things that we've been working with Professor Tanuja Nisari and her team and the High Commission of India is to do a proof of concept that if we were taking to the population yoga and Ayurveda, will it be accepted? What are the governance issues? What are the process issues? What are the delivery issues? What are the conversations we need to have so that it becomes mainstream? A bit like Mark Rosenberg was saying in Germany. Germany is in a more fortunate place where they have adopted it and they've had it for many years for rehabilitation and restoration. They could always use complementary medicine, so Ayurveda has an easy ride. For us, it's a little bit more difficult because we have a National Health Service which works in a specific way. But we have methods of working, and Professor Nisari, while she was here, we were able to show her what are the methodologies and our limitations to start with. So we're starting a project in a few days, and maybe a few weeks, very soon anyway, where we will be doing for the whole country, they will be able to free at delivery to have yoga and pranayama for anxiety, depression, and fear, because COVID has created anxiety, depression, and fear with populations who either have suffered with COVID, are fearful of suffering with COVID, or have long COVID. So breath and movement is quite important there. So we will be doing 8 modules 3 times and evaluating the subjective value to the participants. And for Ayurveda, there will be a diet and for improving immunity and resilience, and lifestyle, again, 8 modules delivered 3 times, and we will be evaluating. So that is starting now, and we will finish in May, June. So that will be done for us to evaluate what is changed, and that will be available. The other bit we're doing is developing a draft for the Center of Excellence, which will hopefully be a built-for-purpose center in the UK, which will have for delivery and demonstration of therapies, including for Ayurvedic therapies and homeopathy and all the Ayush therapies, innovation and development, so that we can bring scientists, researchers, and practitioners to drive new research and apply research findings to create new therapies in line with traditions and practice, to evaluate the effectiveness and value. So the bits that we were saying earlier in this session, and what Prime Minister said this morning, was that the evidence-based validated therapeutic pharma of Ayurveda has to be there first, because the traditions are that we must, at first, we must create no harm. So anything that we prescribe doesn't need to create a harm, and then we must do good. So we have to do both. And what Prime Minister Modi was saying, and which will be really applicable for whoever's in the West, and our Beacon site will be able to show that, is important. And also creating sustainable health services. That was the third part of our project, is that if people remain well and if they get sick, get better quickly, then the burden on the health services will become less. And at the moment, all health services around the world are straining under the burden of COVID and lifestyle diseases. So we have to turn that tanker of medicine to a different direction. And so the collaboration with Western traditional medicine, with Ayurveda and Ayush is an important one. It has to be done in a systematic way. It has to be done in a way that our populations understand it, not only the Indian diaspora in this country, but also the Western English people want to embrace it, and that it is promoted by our senior leadership. So it has to go very high, and that's what we're aiming is. So that's why we're working with Prince Charles, and he will be briefed today on the stuff that we're doing. And of course, he works very closely with Prime Minister Modi. They have a close relationship and friendship. So we are hoping that the project and the MOU we've signed, which is an umbrella MOU, will now progress very rapidly because all the basic cornerstones have been created. And today was a really important part of that discussion, which I will take to, because I'm working alongside the WHO, how can we collaborate across countries and create something with you? Thank you.
Thank you, Dr. Amit Bhargav, for this elaborate answer and covering all aspects, how actually it can be integrated and what is the scope in future. We also have the representative from the WHO, Dr. Kim Sung Choi. Dr. Kim Sung Choi, he is the advisor in the WHO Southeast Asian region, and he is the technical officer of the traditional medicine at the WHO CR office. He has a significant contribution at his credit in developing the WHO strategies and the policies, especially in the CR countries and their implementation in these CR countries. Dr. Kim, I would like to come to you, and I would like to ask, especially in the background that in the morning you saw that the DG WHO, Dr. Tedros, he was there through his video message, and he made the announcement for this establishing this global center for the traditional medicine. So, what is the WHO's perspective on the role of Ayurveda in COVID-19 and the initiatives of the CRO countries through the integration of their traditional health systems in the management of current pandemic? Because I believe that most of the traditional systems they might have some in common, and many countries they have taken some initiatives. So this is first question that I would like to ask, and in connection this, the second is that the WHO and the Minister of Ayush so have this collaboration, and they have also entered into an MOU. How can the internationally acceptable criteria for the assessing and the effectiveness of the traditional medicine, I would say not only the Ayurvedic medicine, would be useful in creating the scope for their global action?
Okay, thank you, Manoj, for giving me opportunity. So it is my great pleasure to respond to a question on this auspicious occasion. With regard to your question on what is the WHO perspective on the role of Ayurveda on COVID-19 and initiatives of the CRO country. As you know that Ayurveda is one of the important systems of traditional medicine, and many countries of this region recognize it as important and main systems of traditional medicine in their health system. In the Southeast Asia region, you know, there's almost 80% of the people are using some form of traditional medicines for managing their health problems. That's why WHO launched the Global Traditional Medicine Strategy in 2013 with the recognition of the importance of the traditional medicine and continuously supporting member countries in this field. As you know, that the Global Traditional Medicine Strategy, there are two main goals. One is harnessing potential contribution of traditional medicine to the health, wellness, and person-centered healthcare. And secondly, to promote safe and effective use of traditional medicine through research and regulation. So in order to achieve these two goals, global strategy also clearly defined three strategic objectives, like building knowledge base, strengthening regulatory systems, promoting universal health coverage through integration of traditional medicines into the national health system. So we strongly believe traditional medicine has the potential and can play a certain role on prevention of COVID-19, particularly from becoming severe condition. And also they can play the role on managing many symptoms and conditions of COVID-19 while shortening their recovery period. So in order to prove those effects, that the many countries in this region, including India, Indonesia, Nepal, Sri Lanka, and Thailand, have initiated a number of clinical research projects for their traditional medicine against the COVID-19, while some countries issued the national advisory on the use of traditional medicine for the prevention and management of COVID-19. So today, as we all know that Minister of Ayush has initiated more than 80 research projects on Ayush systems of medicines against the COVID-19 during the last 6 months. So these are very, very promising. So I'm quite sure in near future, we can see the good outcome from those research projects. And also, today's presentation made by many of you shows the evidence and their endeavor to generate evidence for traditional medicines against the COVID-19. More importantly, many countries of Southeast Asia region has already integrated traditional medicines into their national health system at a different level to varying degrees. So in this COVID-19 pandemic era, many traditional medicine practitioners also involved in health education, case detection, contact tracing, patient isolations for COVID-19. So it means that they are not only providing traditional medicine services, but also providing support in responding to the surging needs in this pandemic era. So overall, what I believe that the traditional medicine has the potential to prevent and managing COVID-19, but also it has the potential to strengthen our health system. So in terms of the collaboration between WHO and Ministry of Ayush, as you know that we have many years collaboration between WHO and Ministry of Ayush in the area of traditional medicine. Particularly in 2016, WHO signed the MOU with the Ayush Ministry to promote and strengthen traditional systems of medicine. So through this MOU, WHO we have already initiated developing WHO publications like benchmarks for and the practice in yoga, Ayurveda, and Ayurveda, and also initiate developing standard terminology of Indian systems of medicines for ICD-11. We are also collaborating with the Ministry of Ayush in strengthening safety monitoring of traditional medicine products through the pharmacovigilance, and also support each other in building research capacity through international conference, seminars, and workshops. In terms of the internationally agreeable research method, in my view, using the golden research methodology, like a double-blind randomized case control clinical trial, in assessing efficacy and effectiveness of traditional medicine is important in creating scope for the globalization of the Ayurveda in COVID-19 era. But at the same time, it's also quite challenging in simply applying this method in traditional medicine research because of the complexity of traditional medicine. So as you know that many traditional systems of medicine has been built on their own theory and principle and experience. Therefore, they have their own specific way of diagnosis and treatment with a holistic and personalized approach. And also, traditional medicine products contains multiple ingredients. And traditional medicine treatment is also often combined with multiple interventions, including herbal medication, procedure-based therapy, lifestyle, and dietary guidance. So this is a very, very different from allopathic medicine, which is mainly focusing on single molecule and symptoms and pathogens. Therefore, it is important for us to find appropriate research methodology for assessing the efficacy and effectiveness of traditional medicine. So we may consider to apply multiple research methodologies, such as the whole system research, black box designs, ethnographic studies, observational studies, pragmatic trials, pharmacoepidemiological study for the evaluation of traditional medicine interventions. So in order to work out this issue, we, WHO, we have already collaborated with the Central Council for Research in Ayurveda Science, which is under the Ministry of Ayush, in developing regional guidelines for traditional medicine research. So we will have this zero draft before end of this year. And I hope one day traditional medicine researchers and community can have this guideline which can help them identify appropriate research methodology according to their research question and objective. Today, I'm also very happy to know that on this auspicious National Day of Ayurveda, WHO and Ministry of Ayush, the government of India agreed to establish a global center for traditional medicine in India. I strongly believe all these initiatives can further contribute to strengthen traditional systems of medicine and scaling up the globalization of the traditional medicine. Thank you. Over.
Thank you very much, Dr. Kim, for giving this elaborate answer and the different modes of research. As we mentioned, the Ministry of Ayush has already been actually undertaken these various types of research to get this scientific recognition to Ayurveda, not only in the CR countries, but in entire the world. Now we move forward, and all of you may accept that the only practitioners and the supporting staff is not sufficient, but at the same time, the quality of medicine, so that is also very important. That's why we have two panelists from the industry. We have Mr. Ranjit Puranik. Ranjit Puranik occupies the position of the Chief Executive Officer and the Director of the Group Office Limited. He is the President of Arya Prasaraj Mandal, which is Ayurveda College at Science. Mr. Puranik is also on the board of the Oriental Aromatic Limited. Why there is this disturbance? And the World Ayurveda Foundation and the All India Ayurveda Congress and the Secretary of the Vijnan Bharati. So having many caps on your head, Dr. Puranik, I would like to have two questions from you. One is that, as it was mentioned by the Prime Minister in the morning, that there was a huge demand for certain types of medicines during this pandemic. So demand and sale of Ayurveda has definitely increased during this current pandemic. How the industry responded and contributed on its part during this pandemic situation. So this is one question that I would like to ask. And in relation to that, the another is that the surge in demand in Ayurvedic medicines also may have impact on the quality of the raw material, because we know that the raw material cannot be grown in a day. It definitely takes planning. It takes 6 months to 1 year or maybe more. And it was foreseen. It was not foreseen in the pandemic. However, this Amruta campaign was launched last year by the NMPB, and presently, instantly, there was a lot of requirement for the Guduchi. So, how do you see this impact on addressing the scarcity of the raw material and the preparedness that is required in the future?
Greetings to all. I hope I'm audible. And, it's a pleasure to be here today and share my views. Dr. Nesri, first and foremost, the Prime Minister is right that our business is the opportunity and word generally used in COVID-19 treatment. Did see a huge spike in sales. There is no doubt about this. Companies who are also fleet-footed introduced products that were recommended by Ministry of Ayush through its various press circulars as well as COVID-19 management advisories. And as a result, the commerce in the Ayurvedic industry did grow. I must tell you, you've referred to something like what was the contribution of the Ayurvedic industry. And I can tell you there's not a single company that has been manufacturing over the past 6 months which has not contributed its might in partnering local authorities, whether it is the district collector or it's the local health centers or it's colleges or even doctor associations who have come forth and set up these kind of COVID preventive camps. And tons of medicines have actually gone. And I would not say it was a very coordinated effort because it was a lot of voluntary work that was taking place. And as such, in my opinion, you would have seen and heard industry who did on the front foot in terms of public health initiatives. So the other part that you've also talked about is, we are still not over the hump as far as COVID-19 goes. And coordination in this entire time, because industry could have done much more. Industry certainly did contribute its medicines and quality medicines towards all the research protocols and research initiatives that were being unfurled by either education institutions or even government laboratories. But I think much more can be done. And, there are all kinds of reports that talk about the second wave and the third wave and all such kind of issues. We see Europe also besotted with all kinds of problems once again. And I think, some kind of advisory from Ministry of Ayush, two-pronged advisory, not only, something that NIA has launched, which is the post-COVID care kind of protocol. And second part is the entire, if the second wave and the third wave has to come, how should local authorities respond? And you will see that industry and Ayurvedic industry, and I speak for all my colleagues, you will see them contribute in measures that are hitherto unknown. And it would be a pleasure to serve the country and our own society as we have for millenniums. So the other part you spoke about is raw materials. Fortunately, the raw materials that were used in COVID-19 formulations were not really ones that are sourced from forest, but the ones which have already seen cultivation. So that kind of buoyancy in terms of supply stocks was there. Industry did see a huge amount of problem in terms of procurement of amla in the month of July. But I can tell you that shortage of amla in the month of July for manufacturing of Chyawanprash was only felt for around 3 weeks. Because as God deemed it, the amla season this year also started 3 weeks earlier in the month of August and not traditionally like it does in September. We did see an inflation in prices, but then we did see a settlement in the prices also. And compliments goes to National Medicinal Plant Board because, sir, you talked about the Amruta campaign, which was launched a few months back. But you must also understand that precursor to the Amruta campaign was the Amla campaigns and was also the Ashwagandha campaign. And for the last 2 years, the supply from cultivated species has also checked the inflationary pressures on the medicinal plants. So, many good deeds actually came together and buttressed the industry's capacity to meet this entire COVID-19 pandemic. We were caught unawares. The lockdown was complete and it was a little bit of a shocker. Not many of my industry colleagues could really get their clinics open. I can tell you for the second and the third curve, we are more ready. The Ayurvedic physicians are more than ready. I think we can go on the front foot and let's just do exactly what we did in the month of April. Ministry of Ayush aggressively pursued solutions, aggressively pursued, public statements that talked about visit your Ayurved physician, rely upon Ayurved or rather Ayush. And I think this is augured well. Even my friends in homeopathy and Siddha would also talk of the same kind of positive news that they would have to share. And I think, this economic package that the government has given of 4,000 crores for backward integration of medicinal plants, not only the long gestation medicinal plants of the Himalayan region, but also the Ganges plain. I think this is going to be the turning point where we are going to give the farmers alternative profitable crops than whatever they traditionally used to rely upon. And I think a lot of work to bridge the gap between the demand and the supply is something that's just on the anvil. So compliments again to Ministry of Ayush. On behalf of the industry, I would certainly, sir, take this forum to convey our gratitude for, absolutely being there on the front foot, not only initiating research activities, but also popularizing the interim report in terms of the research findings that you got. All of this has spelled great positive broadcast within the entire sector, which has also got the Ayurvedic physician back into the clinics. Coordination by Ministry of Ayush with either Ministry of Commerce. All of this augured extremely well, and I think we're ready for second and third curve. I'm not let it come. I hope it does not come. But if it does, I think India would be in much better hands than what was the shock in March and April. Thank you again for giving me this opportunity to share my two views. Thank you.
Thank you, Ranjitji, for this sharing your views. I don't know, there is some problem from this side probably, and this is causing disturbances. Anyway, so I would like to ask now Shri Arvind Vachasvi. Shri Arvind Vachasvi is the managing director of the Sri Sri Tattva. The Sri Sri Tattva is the well-known Ayurveda pharmacy, as all of you know, and having its global presence in many countries. And the Sri Sri Tattva is exporting the products to almost half of the world. Sri Arvind Vachasvi, he is the eminent industrialist and the enthusiast and the successful entrepreneur. He is also the advisor to the Pharmaxil and the co-chair to the FICCI. Arvind is his primary project is one of the flagship bearer. The Sri Sri Tattva is the flagship bearer of the quality of Ayurveda and India worldwide. Mr. Arvind, you are having a lot of this philanthropic activity as well, and since also you are engaged in a lot of research, you also have registered your products, and you also have this laboratory which is internationally acclaimed. So in this background, I would also like to ask you about the industry academia research, because you had been actually involved in this academia research. So in this current pandemic area, what would be the role, or what is the role of the industry and academia partnership has to play in bringing the Ayurveda to the forefront? Because we saw that many these various partners, what we saw today, so they are really willing to have collaboration and to have research, and not only these, there are many. So what would be the role of the industry academia partnership? This is my first question. And the second is, what are your views in conducive policy for facilitating and enhancing the international export of the Ayurvedic drugs?
Dr. Nesri, thank you very much for having me here. At the outset, I would like to wish everybody a very happy Ayurveda Day today. My fellow panelists, Vaidya Devendra Trigunaji, Professor Tanuja Nesriji, Mr. Mark Rosenberg, Dr. Dilip Ghosh, Mr. Dr. Amit Bhargav from the United Kingdom, Dr. Kim from WHO, Ranjit Puranik, my very good friend, and all the people watching here. I'm wishing all of you the best of health during these very tough times that what the entire world is going through. And I'm sure with the contribution of the system of Ayurveda, the world would definitely see that, the very much required part of health is restored across the world. Dr. Nesri, coming across to your first question, that what is the role that needs to be played with regards to Ayurveda in the space of both education, and also how is industry going to be impacting the same? I feel that over the last 1 decade, what's really changed is that industry and educators are coming together and really seeing that what can the science do better. And that's where a lot of research has happened. You would see that over the last 1 decade, a lot of research papers in the field of Ayurveda have come up, whether it's with regards to diabetes management or blood pressure, or whether even if it's like things like diabetic wounds. So when this particular pandemic came up, what's really very encouraging from the government's perspective is that the entire Ayush systems were also made as essential commodities. And this really gave a huge boost a moral boost also, I would say, for both the educational sector and also the industry sector to for the Ayush systems. For you to do anything, for you to do something big, you need to have the knowledge, you also need to have commerce, and you also need to have the blessings of your government to do that. And I think that the entire Ayush systems have that right now. And industry per se is really feeling very encouraged to see that how research can happen. There are a whole lot of new ideas and also schemes that what the government is coming across and ensuring that how industry can participate. I would urge all our educators and also industry to come together and do more research in the field of Ayurveda and also Ayush. I would like to also make a very strong point over here that it is important that a right message goes from this particular platform, that there's already a lot of research that has happened in the field of Ayurveda and also Ayush. We normally find people stating that there might not be enough research in the field of Ayush. I would rather say that there's a lot that has been done in the entire system of Ayush, but we need to see that these are properly brought together and also presented in a way that how even the present systems of medicine like allopathy also would accept. On another front, what I've always maintained is that Ayurveda is a system of medicine and allopathy is a system of medicine. Both of them have their own advantages and their, and also their strengths and their weaknesses too, if I may put it across that way. When it comes to allopathy, there's nothing to beat it in terms of accidental care and critical care. But when it comes to lifestyle disorders and also answers that what the allopathy system does not have, the Ayurveda systems definitely do. Having said that, it's important that we realize that the standards that what we set across for both these two systems also cannot be the same. They all have the entire principles are completely different. And that's why even in the field of research, it is very important that we set across certain standards that how we would actually treat both these two systems. The moment we start looking at them with the same set of glasses, then we would really see that, okay, which is better than the other. But I think in today's age where the consumer and also people are extremely educated through the advent of greater technology and also information just being there with them with a click of a button, people are very clear on what choices they have to make. Today, Ayurveda and also the entire Ayush systems have really shown across to the world that why they are a timeless science. Something that is timeless also definitely does leave proof. And this is something that what Ayurveda has done. It stood the test of time, which has been there for more than 5,000 years. You would also see that over the last 3-4 months, even during the pandemic time, the University of Yale, Harvard University, and Stanford University happened to do research on the Art of Living Sky program, the Sudarshan Kriya program, where the breathing techniques actually have an impact as to how a person's well-being and also his mental status is. The COVID-19, especially the the lockdown syndrome, people had a lot of issues with regards to mental health. I would like to put across a data point over here that the Art of Living's meditation were, searched top when it comes to on Google searches, #1 and also #3. So this shows that how people across the world are really coming across to things other than only allopathy. So allopathy is not the only system of medicine. While it has its place, there are also other systems of medicine that come across and they also carve their niche to where they need to be. Another point that what you rightly mentioned, Dr. Nesri, that industry also needs to get itself involved in research projects. I'm very happy to mention from industry side, whether it's from FICCI and also from PhD chamber, we see a whole lot of industries coming across together in the field of research. And this per se is extremely encouraging. And that's why you would see a whole lot of papers that have been published over the last, 2 decades right now. On the other front, with regards to the international certification, from Shri Shri Tattva itself, I can speak out of experience that we have the WHO CGMP certification for 56 of our products. We are the first with regards to getting the ANMAT GMP as far as Argentina. We also have the herbaceutical certification from the Ministry of Health in Oman. We are also recognized as a botanical medicine from the Ministry of Health in Canada. So what does this show? That there is scope people are willing to accept the system of Ayurveda as a system of medicine. But as long as we take that step to see that what we need to do in terms of getting it recognized, there's a whole lot of dialogue also that needs to be done on this particular front. I see that, Dr. Nesri, you've always been spearheading this from the ministry's front when it comes to international cooperation. We've seen a whole lot of things that are happening. We have the WHO DG coming across today and also mentioning that there would be a center of excellence, a traditional system that what would be put across here in Orissa as well. We also saw our WHO representative mention that how important traditional systems of medicine are, and especially Ayurveda. So the entire world is taking note. So I see that, that all of us have to take the lead from here and really see that we get our system of medicine recognized to what it definitely needs to be. We don't need to see that whether it fits into another system or not. It's a system of medicine by its own right, and stands up on its own. And whether it's industry, whether it's academia, or whether it's the government, we see that all three of us stand tall to see that the recognition of this system of medicine is given utmost importance. We need to ensure that our doctors are recognized, our medicines are recognized, our therapists. So there are a whole lot of things that what we need to put together. And I'm very happy to make a mention that, our Honorable Prime Minister has given this rightful importance that what this entire system of medicines really require. And I feel that this particular due recognition was, very, very long sought after. And I'm very happy that it's come at a very timely moment. And on this National Ayurveda Day, I'm very happy to mention that industry is there together to see that we get this recognized, much more. So having said that, yes, even with regards to the immunity products, we've seen that Shri Tattva has had a huge, boost in demand for its immunity products worldwide. And this really shows that people are here to know that Ayurveda is here to stay. People have the faith that this is a system that really works for them. Thank you very much, Doctor.
Thank you, Mr. Arvind, for this elaborate description and the in the role of the industry academia partnership. It is really required that we should go in this direction. Now we have come almost to the fag end, but we missed the ITRA presentation. Since the IPTRA has been converted into ITRA, so I mentioned the ITRA. Without any presentation, whether the representative from ITRA would like to mention about the research activities of ITRA within 2 minutes?
Yes, sir, sure. I'll just brief it out. Actually, we do have conducted. Hello.
Yes, sir, please.
Yeah. So actually, we have conducted all 3 research works on COVID-19. Out of one is already under the manuscript publication process. One revision has been done, and that is on add-on Ayurveda treatment for early stage COVID-19, a single center retrospective cohort study from Gujarat. Actually, this is the study which is carried out after getting very good results from a cluster of Ayurvedic medicines given in the Samras Hospital, Ahmedabad, during which there is a lot of COVID patients there in the Ahmedabad city. So that is shown a very good result. Second is manuscript which is under the review of publication management unit of Ayush itself. So this study is also completed. This is about Ayush 64 and its clinical efficacy through an open label randomized control trial that is also completed and on the verge of publication within few days. The third one is the multicentric large sample size study, which is a prospective non-randomized open label controlled interventional study on the efficacy of Guruchi Converti. So that these 3 studies we have carried out, and one new project is undertaken recently, and which is communicated with WHO Southeast Asia Regional Office. That is, as just Dr. Arvind said, that we have to come to gather these studies in a very good manner. So this is the evaluating of effectiveness of Ayush intervention of COVID-19 in India, a systematic review and meta-analysis. Just to club the whole studies, this will be the study which will club all the Ayush studies. for the management in COVID-19. So these all are the 4 studies. These are the data which I think time will not permit me to present. So that's all I want to convey here. So is it okay, sir?
Yes, thank you. Thank you, Dr. Sagar, for being really very precise and to the point. So now we are at the end of this webinar. Now all the participants, they have witnessed that not only that the ministry and the India has done a lot of research in this pandemic of COVID through Ayurveda, but at the same time, there are many international partners, those who are actually willing to come forward, they have come forward, and there are many more who are there, and there are many opportunities to undertake the research. At the same time, when we do the research and when we generate the evidence, it is also linked with the recognition to the system. All of you know that the Ayurveda has been recognized in many countries across the world, whether it is in the Indian continent, Indian subcontinent, whether it is in the Gulf countries, whether it is in Africa or many others. So there is more and more recognition. It is on, and as the Prime Minister has said, that it is the rising sun field, the Ayurveda it is, and we must work more and more hard so that we can get it as early as possible. So at the end, I would like to congratulate all the participants, those who have participated in this. At the same time, I am also thankful to all the speakers and the panelists, those who actually stayed long, because some of them, they were from Australia, some of them, they were from the America side. So on one side, it was evening, on one side, it was morning, it was midnight. So despite of the differences in the time zones, everybody, they came very actively, rather proactively together, and they participated. So I'm really thankful to all of them for spending their time and participating in this webinar. At the same time, all the participants, those who have logged on to the this web platform, so all them and those who have logged on to the social media site, so to all of them, I'm really thankful. I'm really thankful to the Honorable Minister of the Ayush, Sri Patnaik, for continuously supporting us and giving us the guidance. And not only that, continuously encouraging us. And his guidance and his encouragement has actually enabled us to excel in the work of the ministry. I'm also thankful to Vaidya Rajesh Kotecha, whose dynamic leadership has definitely enabled us to steer forward and to get connected with the many more ministries of the Government of India. And because of that, now this is not the function of the Ministry of Ayush, but the Ayurveda Day has become the function of the Government of India, and that's why it has gone globally. In this, to take this globally, all the Indian missions abroad and the Ministry of External Affairs, so they have significantly contributed, and I'm really thankful to the Ministry of External Affairs and all the Indian missions abroad, because this program has gone almost more than 150 countries across the world, and we have been receiving many compliments at the same time, some kind of questions and other things from the different parts of the world. So I am really thankful to them. I'm thankful to the international cooperation team. I'm thankful to Shri Mr. Pathak, who actually has been continuously monitoring the various activities of Ayurveda Day, and also Mr. Ranjit Kumar, who was also looking about the publicity and coordination with the PMO and many more aspects of this overall Ayurveda Day. So I'm thankful to both of them, and I'm also thankful to my team in the Ministry of Ayush. It is Dr. Suniti, Dr. Rahul Jain, Dr. Ashwin, Dr. Dedge, Dr. Vinay. So all of them, they are here, and I'm really thankful to them. Because of their support, this program could be done. And at the same time, my personal staff, including my PS, Mr. Batra, and the PS Virender, Mayank, and everybody. So everybody actually had supported us. And most importantly, I am really very much thankful to Praveen Mittal and the FICCI team, because the FICCI team, they actually came forward, and this digital platform has been provided by the FICCI, and the entire IT team of the FICCI, they provided the IT support, because in today's world, there cannot be any program without the IT support. So this support has been provided by the FICCI. So Praveen Mittal, Nishan Bhatia, and the entire team of the FICCI. So we are thankful to all of you. And we are also thankful to the media and the Doordarshan who have supported in this broadcasting of the inaugural program. So we are thankful to all of you. Thank you very much. And with these words, I declare that this program has come to end. So thank you very much.